Good afternoon, everyone, and good morning to some of you on the West Coast. I would like to welcome you this morning to the AFTO Advanced Inspector Bootcamp, January 9th. This is the first of the Advanced series. My name is Angela Montalbano. I am currently the president. Good morning from Tennessee. I'm currently the president for the Association of Food and Drug Officials, and it is my honor to welcome you to the Advanced Bootcamp session today. But I would like to say, before we begin the session, I would just like to give just a moment of silence for President Jimmy Carter as the services are taking place today. Thank you for that. Respect. Okay, so as we move on, we'll start with a little bit of housekeeping. I'm assuming that since we have, just so you know, over 700 attendees today, which is a phenomenal number. I'm happy to hear that we have such a large number in attendance. We'll do a little housekeeping, talking about some Zoom orientation and expecting that you feel very comfortable in this environment and that you're in a very comfortable spot here. And you should be able to share your thoughts, your concerns, and your questions, and interact with the presenters, and feel that you're in a safe environment here. So we're really all just here to learn. So just please, we ask that you are respectful, but please feel free to ask any questions that you may have. And in Zoom, which I'm assuming many of you have already been introduced to for several years now, there's a chat option on the bottom of the screen. And then there's also the question and answer, the Q&A, which is also at the bottom. So you can feel free to use either of those outlets to ask your questions or to share your comments. Within that chat box, there is a little toggle where you can either discuss your questions simply with panelists and the presenters, or you can go directly to someone that's in the list. And on the screen, you can see here, we have two names this morning. If you have any technical difficulties whatsoever, we have Christina and Autumn. I do strongly suggest that you take their names and phone numbers and make a notation of that in case you do have some type of an issue throughout the process here. Good morning to everyone. We have lots of chats happening. So on the next slide, we will share a couple of poll questions with you to start this process. And the first poll question is, who is in attendance today? So hopefully in the center of your screen, you'll see that there's a general poll. There are two questions to be asked. And if you just click on one, and then your responses will be submitted. So the reason we do like to ask is who's in attendance, and it does give us an idea as to who the presenters are speaking to. And then also it gives you the opportunity to see who's on the call. So you can network with them, you can exchange contact information. And a really good aspect of this is so you can, in fact, save these folks, so their names and numbers, so you can utilize your relationship with them, create a relationship with them, and then hopefully a friendship. Because as I shared yesterday, we had the basic boot camp yesterday was the first one. I did share that I've been a member of AFTO, I don't know, I think it's over 20 years now. And I can share with you that I have made some tremendous lifelong friends throughout my membership and being on the board across the country. So I do encourage you to share and meet some people and have some fun with this today. So we'll look to see the responses. I think we'll give it another second to see what the answers are to the poll questions. So the first one being who's in. Okay, so here we go. It's interesting. It's very similar to yesterday. We had about 70% local, about the same for state. I think it's actually the same exact percentage, and the same percentage for the federal. We had someone from other yesterday, and I don't know what the other was. And we also didn't have anyone from tribal and territorial. And I did say we should all be working on that, because I think that's really important to include our other folks that do the same work that we do. So that actually is something that I've been working on this year myself. So I would encourage you all to do the same. If you know anyone that does work in a tribal territory, opportunity is a great opportunity for us to get in touch with them and introduce them to some of the outlets that we have, to AFTO, or to one of the affiliates that AFTO has across the country. All right, the second one is, how long have you been an inspector? So 0 to 2, we have 6%, which is what is expected because yesterday was the basic. And that basic boot camp is for the 0 to 2 years. And then we have 2 to 5, we have 30%, and 10 plus, which is wonderful, we have 36%. So that's really good. Okay, so now we all have an opportunity to know who's on the line with us. And if we move on to the next slide, we'll show a brief portion of the agenda. We have a full agenda of phenomenal speakers with a wealth of knowledge, as you can see. We will be talking about environmental health specialists, about foodborne illness outbreaks from an environmental specialist, TSC foods, if they are or they not, from Adam Inman in Kansas, and the mindset quest to personal success, which is great because we can all actually utilize that. So I do hope that you take the opportunity to share any of your thoughts and questions, like I had mentioned, either in the chat box, which is loaded with 60 comments in there so far, which is very cool. We're just getting lots of good afternoons and good mornings. I know it's afternoon. I'm in New York, so it is definitely afternoon for me. So next slide, we'll talk about the objectives, and you'll find some resources for these objectives today. It will talk about your environmental assessment that we just said, foodborne illness outbreaks, and temperature control for safety. And then we'll talk about your personal success. So you will find these resources for these topics on the AFTO website. After today's session, it will be on the Bootcamp portion of the AFTO website. And in addition, this entire presentation, all of them, the entire day, will be recorded, and it will be also placed in that same location. So I do encourage you to, maybe you took some notes, but you missed something. So I do encourage you to follow up with that and maybe share some insight with your team when it's over. So thank you for the opportunity. It is my honor, quite honestly. These boot camps have been phenomenal, and as you can tell, over 700 people. I think that's really amazing, and kudos to Autumn and her team for getting this all together and making this happen. But I would like to take this time to hand it over to your first moderator, and that is Brenda. Good morning, Brenda.
Thank you, Madam President. My name is Brenda Morris, as Angela said, and I serve as the Director of Produce Safety for AFTO. And I originally was working prior to AFTO with the Florida Department of Agriculture, where I oversaw the manufactured food and retail programs. I am so excited that you're all here, and fabulous to see all the welcomes and hellos. And I would like to go ahead now and get our first session started. It is conducting environmental assessments during foodborne illness outbreak investigations. And I'd like to introduce to you our speaker, who is phenomenal with this. So Danny Ripley from the Tennessee Department of Health will be speaking on this today. He's an environmental health specialist in the foodborne and enteric disease program of the Tennessee Department of Health. He has over 25 years of combined experience in food safety among private, local, and state government, also a little bit of federal government. That's a big deal when he has all of that. He's participated with CDC's Environmental Health Specialist Network since 2003 and is currently responsible for fulfilling Tennessee's environmental health safety net responsibilities. He facilitates foodborne outbreak investigations in Tennessee, and he conducts foodborne outbreak response training throughout Tennessee and surrounding states. I am very pleased and honored to be able to introduce Danny as our first speaker. Take it away.
All right. Brenda, thank you so much for that kind introduction. And I will go ahead and jump to screen share if I can. Well, there it is. And does everyone see the intro slide? Can just someone confirm that they see the intro slide?
Not yet. Here we go.
All right. Okay, so let's jump right into this. Thank you very much, everyone, for your participation, allowing us to come out and present on topics that we truly enjoy talking about and sharing. And what I'm going to talk about today is conducting environmental assessments during foodborne illness investigations. I've got a lot of slides here. I'm going to go through this fairly quickly. And if you have questions along the way, I've got some folks on our team that are standing by that can answer questions as well in the chat. So feel free to ask those questions as we go along this process. Again, a lot of material going to move pretty quickly through this. So, and I think we'll have time at the end for some question answer as well. So without further ado, let's see if we can advance. All right, so our objectives for this particular talk, we wanted to discuss foodborne illness impacts. We wanted to describe foodborne illness investigation team, what that team looks like. We want to discuss contributing factors and their root causes, or antecedents, as they're sometimes referred to. We want to discuss the methods of an environmental assessment. We want to summarize traceback investigations and control measures that might be employed during outbreak investigations. And then finally, we want to provide a case in point investigation that kind of helps summarize all of these methods that we talk about, or at least some of the methods that we talk about during an actual outbreak investigation. So I have a first poll question for you. I've got several poll questions. I think there's 8 or 9 total in this particular presentation. So if you would, please, and I think some of this might be redundant from the earlier poll question, but if you could just indicate the number of years you've worked as an environmental health specialist and or in the food safety arena. I'll give you just a second or two to complete that poll. All right, that shouldn't take too long, so we can go ahead and advance. All right, so it appears that the overwhelming majority are between 1 and 10 years. And I think that's consistent with some of the other earlier polls, and which is actually great because a lot of the concepts we talk about, I think are going to be very fitting for folks who've got some experience, but may have not had a tremendous amount of experience in foodborne outbreak investigations. So fantastic. And we have another poll question. How many foodborne outbreak investigations have you participated in? And moderator, if you, as you see, Brenda, as you see those coming in and they start slowing down, go ahead and you can post any moment. Perfect. All right, so again, it looks like 1 to 5 being the majority. So most of us have a relatively limited number of outbreaks that we've investigated. 17 over 10%. So we've got some folks that have been around a little bit, or at least been exposed to a few outbreaks. That's quite a few. Depending on where you're at in the country, and you know, the area that you may be responsible for, you may not have a lot of outbreaks. We've worked with folks out there across the country who've worked in environmental health for years and not had one foodborne outbreak investigation. So really depends on the population, the number of establishments, a lot of different factors in terms of the experience you get with outbreak investigations. Regardless, though, I think what we're going to talk about as we move through this will help, whether you've been involved in hundreds of outbreak investigations or you're still at that in that 21% with no outbreak investigation experience. All right. Okay. So I don't really have to emphasize these points with the audience here, but obviously foodborne illness has a tremendous impact at 47.8 million cases a year, 128,000 hospitalizations, 3,000 deaths. And that translates to quite a bit of money and quite a bit of expense for both consumers and the industry itself at estimated 15.5 billion that's associated with those things, such as chronic illnesses, the medical costs, the costs associated with lost wages, and premature death. So again, I don't have to twist anyone's arm in this audience about the importance of foodborne illness and outbreak investigations, but it is important to always highlight those characteristics. So the goals of an outbreak investigation, I'm just going to go through these very quickly. We want to find the source of the outbreak, and we want to identify the cause of that outbreak. We also want to identify the pathogen or agent involved in the outbreak if we can, and also ultimately to prevent additional illnesses, to stop the outbreak as quickly as possible, and implement short-term and long-term or institutional control measures. And a lot of factors go into this model here and achieving these goals. We want to make sure that we have understandings of illness profiles. We want to have the association with the environment, the food. We want to try to identify contributing factors and root causes. So to get to our goal of identifying an outbreak and stopping an outbreak and putting controls in measure and preventing future outbreaks, you're going to have to understand a lot of these different parameters during an outbreak investigation. So in order to do this, we have teams. And those teams normally consist of three disciplines: the epidemiology, the environmental health, and the laboratory. And below each of these, you can see some of their most common activities or functions within these teams. So for example, epidemiologists, they're involved in case-based surveillance, interviews, conducting studies and data analysis, and also final reporting. On the other end, the laboratory is involved in doing analysis on clinical, food, or even environmental samples and helping interpret those results, and also coordinating testing among other laboratories that are outside of your jurisdiction. And then there's the environmental health, and that's what we're going to focus on in this talk. In the environmental, we do a lot of different things, from investigating the environment that the event may have occurred at, collecting data, collecting information, collecting samples, interviews, and doing observations. And also part of our reporting, we do provide an element of the reporting, our final reporting, during these outbreak investigations. So I want to focus next on the environmental health activities that might be typical of a program out there. And we have environmental assessments and regulatory inspections and other food safety systems. And we use HACCP here, or Hazard Analysis Critical Control Points, as an example. Now, food safety systems like HACCP systems or HACCP plans are part of what we do to prevent problems in the future. And regulatory inspections are what's occurring at the present. So when we go out to do a routine inspection, we're looking at what's going on at that point in time. An environmental assessment, on the other hand, is really looking back in the past during a particular point in time where something could have occurred that caused a problem. And it's really important to make this distinction between a routine inspection and an environmental assessment, because they're quite different. While they may have some similarities, a routine inspection is that broad snapshot, and it's typically non-targeted, although one could argue that we focus now more on risk factors for foodborne illness, but it's still comprehensive. It covers the dumpsters outside to the restrooms inside and everything in between. It's based on codes, regulations, and violations. On the other hand, an environmental assessment really is more focused. It's focused on a working hypothesis that's usually generated at the beginning of the investigation. It may target specific foods or specific processes or even people or points in time. And the goal is to identify a breakdown or failure within those different systems. Now, speaking of systems, retail food establishments have what's called they have a system that's consistent throughout all points of service or food service establishments. And it's important to understand how these different parameters within the system work together. And we're going to talk in more detail about some of this as we move through this presentation. But I want to introduce this concept in the idea of ingredients, organisms, good or bad, and chemicals going into this system through the various different processes from receiving to ultimate service, and then those internal system variables. And we're going to talk more detail about those, but how those internal system variables play a role in the final food item and how it affects the customer health, the customer satisfaction, and the profit. And based on those outcomes will dictate changes to those various processes and the internal systems. So that dynamic is consistent with all food service establishments, and understanding how these internal system variables affect the processes is going to be key in determining what caused a problem and why it happened. So let's talk about what causes problems. And we've got some definitions for what causes the problem during foodborne outbreak investigations. We call these things contributing factors. And we have a definition here. Contributing factors are the most likely conditions that contribute to the contamination, proliferation, and or survival of an etiologic agent or suspected agent. And we've got three buckets of contributing factors. The first is contamination. Contamination is how something becomes contaminated, or how contamination by way of chemical, biological, or physical gets into the food. Proliferation is another bucket, and that's how contamination, once on the food, if it's expected to be on the food or it accidentally was put on the food, how it can grow or increase in number. And then finally, survival is where we have contamination that might be expected to be on the food but doesn't get removed through, let's say, a cook-kill step or a kill process. So those are the three buckets. I encourage you to you can go to this website here and get more information about contributing factors specifically and their definitions. That's much more comprehensive than I have time to cover. But I do want to talk a little bit about the different categories and just highlight some of these characteristics. Your contamination factors, there's contamination factor 1 through 15, so there's 15 different contamination factors. This is not all inclusive, as I mentioned, but it does cover some of the things like unclean equipment, bare hand contact or hand contact or infected worker contact. Those things, again, where contamination may occur from a surface, hands, to the food. And then we have proliferation factors in the middle there. And again, P1 through P12. So there's 12 different categories or 12 different classifications of these proliferation contributing factors. And you can see some of those examples there: prolonged storage, hot hold storage, inadequate cooling, any opportunity where bacteria, for example, has an opportunity to grow and cause contamination. And then finally, we have the survival, which is a much lower number, as you might expect, S1 through S5, inadequate acidification, improper reheating, and improper cooking or cook-kill steps, probably the most common of these. So how do we determine contributing factors when we're conducting a foodborne outbreak investigation? It can be challenging to decide which factor was a contributor to the outbreak investigation. And this is, again, why it's so important to make that distinction between a regulatory inspection, where we're looking at violations, versus a routine, or excuse me, environmental assessment, where we're looking for specific activities. Because a violation isn't always a contributing factor. A contributing factor is always a violation, but the converse is not always true. So we want to make sure that we use the available information that we have at that point in time from the environmental assessment, the epi studies, and the laboratory findings, and see what makes the most logical sense. There should be a relationship between whatever that condition or contributing factor that we're identifying has with the food, the practice, the person, or the etiology. So there should be a working relationship there. And there may not always be just one contributing factor. There may be multiple contributing factors. But again, if we indicate this as a contributing factor, it really should have an impact on either the food, the process, the person that's involved in this outbreak investigation. And then finally, understanding contributing factors have some degree of ambiguity. They are subject to a degree of interpretation, which can be challenging. And what we do when this happens is we always refer back to our team and have the team look at all the data and say, what do we feel like the most significant contributing factor or contributing factors are in this particular outbreak investigation. All right, so let's work on just use an example of contributing factors. And this is a little exercise. I have a poll question at the end of this exercise. So in this particular example, you're investigating a lab-confirmed salmonella outbreak. Now, we haven't talked about surveillance and how surveillance plays a role in the initiation of outbreak investigations, but typically we have two different types: complaint surveillance, where they come in complaints with limited information, usually. And then we have pathogen surveillance, where we get the notification of something going on through a lab report. So here we have a lab-confirmed salmonella outbreak. So we've been made aware. We've got 7 people, 4 households that are represented here. Several different foods have been reported initially. No clear epilink at this time on a specific food. And then all reported foods were prepared on or stored in the cooler A, is indicated here. So you can see in the diagram here, or in the illustration rather, you got a prep cooler A, prep cooler B. So in our environmental findings, so when we conducted our environmental assessment, these are some of the things that we found. So we got 4 points that we bring up as interesting notes on our environmental assessment. The first one, raw chicken juice on the cooler prep A. So we got some raw chicken juice that's on the prep table of prep A cooler. We've got a reach-in dairy cooler holding at 55 degrees. We've got a hand sink out of order in one of our public restrooms. And we've got rice improperly reheated to 115 degrees Fahrenheit. All right, so given that, poll question number 3, given those 4 observations, which observation or observations are most appropriate to report as contributing factors for this outbreak? I'll give you a moment to select which you think is appropriate, and we'll look at the responses. And while you're deciding, there's always more information that could be helpful. But if we have very limited information, what would be at least your low-hanging fruit in this particular scenario? Oh, wow. Okay. So we've got a variety of responses. So observation 1, the first observation, raw chicken juice at 29%, and then 1 and 2 at 17%, 2 being the dairy cooler. 1, 2, 4 at 25%, and then 29, or almost 30% at 1 through 4. All right, so let's advance and talk about this scenario. So in this particular event, and this was an investigation that was conducted a few years back, what we learned was that raw chicken was being stored in prep cooler B. As the raw chicken was being moved over to the frying area or the cook area, there was raw juice that was contaminating this surface. And this surface, then once foods were prepared, ready to eat foods were being prepared right back on this surface. So what we concluded in this particular investigation was that there was a contamination factor of a lack of cleaning and sanitizing or separation of raw ready to eat in this particular event that led to the contamination of probably a lot of different foods over that point in time. So if we had to select only one, we would probably select the raw chicken juice from prep cooler A to the table. Now, the information about the chicken being moved over, you didn't have that as far as you're given, and it may cause you to select a little bit different response. But let's talk about the other 3 responses, because we put those in here as red herrings. meaning they're significant, they're important, and they have to be addressed when we see them. But do they have anything to do with this particular outbreak? The reach-in dairy cooler at 55 degrees, if it's not associated with any of the foods, again, the devil's in the details, but if it's not associated with any of the foods, most likely it's not. Is it a violation? Yes. Is it something during a routine, or excuse me, during an environmental assessment, you would still have them fix? Of course, but it's not something that might be contributing or might have contributed to the outbreak excuse me, to the foodborne outbreak. Same with the hand sink. And same with the rice. All three of these are pretty significant issues, whether you were doing a routine inspection or an environmental assessment, and they have to be fixed. But the point here is making sure that when we select or we determine contributing factors for a foodborne outbreak investigation, we're really focused on exactly what went wrong that contaminated the foods or food that made folks sick. So sometimes it's very challenging to identify these contributing factors. Sometimes it's challenging to get the investigation off the ground, especially if you're dealing with foods that are unfamiliar, ingredients that are unfamiliar, or you may have limited experience in outbreaks to reflect on. One thing that we use that I think is a wonderful tool is the procedures to investigate foodborne illnesses. This is through the IFP. This is a manual, and I want to just go through some of the resources that we use when we initiate an investigation where we have a lot of missing gaps or missing information, and we're trying to fill in that information as best we can during our initial environmental assessment. So if we look inside this tool or this resource, it's in one section of this resource, we have different sections of different foods, and we have in this particular example we have vegetables. So and then we can go down through those various vegetables and understand if we're dealing with a bacteria or a virus or what specific pathogen we're dealing with. Where do we start? Where do we focus on that particular food in the kitchen environment? So with this particular in this particular example, as you can see, there's field, farm, processing, and then the retail food service areas. And we're focused on primarily, and not always, depending on where the environment this outbreak is in, but primarily at points of service. So at the retail level, where the foods are being processed, sliced, diced immediately prior to service is typically where we're focusing our investigation. And if you look here, there's a grid in this section where it has different levels of severity from X, red X, green check, the purple triangle, and so forth. And as you move down through, and let's say we're focused on leafy greens, and in those leafy greens, we have a salmonella outbreak, or maybe we suspect salmonella, then we would move across and we would go and we're of course in the retail store or food service areas, and where these indications of the purple triangles or the green check marks would be our starting point. So this is where we would focus our attention. Again, if we have limited information, we would probably say, okay, let's look at improper refrigeration or inadequate refrigeration as one of the first areas, and then work out from there. And doesn't mean that it's always going to be there, but it's certainly areas that we can begin to work and move through as we do our investigation. So if you're unfamiliar with particular outbreaks and you have this resource, you can begin even before you set foot into the restaurant and saying, okay, what's going to be our plan? Where are we going to look as we go into this establishment? Here's another example of a vegetable outbreak, and we have norovirus as either our suspected or confirmed agent. And then obviously we're going to be looking primarily at food workers as a potential source of the contamination. So again, this is a resource that you can use that can be valuable, especially if you have limited experience in outbreak investigations. You can use this as a starting point. There's a lot of other resources in this tool, and there's other resources that we have provided links to in this presentation a little bit further along. Okay, so let's shift over to environmental antecedents, or as they're often called, root causes. And an environmental antecedent or root cause is the conditions leading to the contamination, survival, or increase of biological or chemical agents in food. So understanding environmental antecedents or root causes of the contributing factor are important because they help us put better controls in place, more long-term controls, more controls that prevent things from happening in the future. And we can put environmental antecedents into really kind of 5 buckets, that being equipment issues, economic issues, process issues, food issues, or people issues. And we're going to talk more detail about these as we move through. Now, this concept of identifying environmental antecedents and root causes is relatively new. And there is some nuance with the whole process of determining which environmental antecedent is appropriate to address. But there's some guidelines that we do have here that I think can help kind of navigate through those decision-making processes. So in terms of in terms of understanding or determining the environmental antecedents, it's going to be achieved primarily through interview. So asking managers or food workers is usually how we get to the bottom of what environmental antecedents or root cause contribute to that contributing factor. As opposed to contributing factors are usually identified through observation. Manager and employee interview skills are very important and very critical in understanding the root causes of contributing factors. Often there are multiple environmental antecedents as well. And it's important to kind of try to distinguish which has the greatest impact to the contributing factor and which might have a best control measure that we can apply to that. So they should, just like contributing factors, should make logical sense. They should have a connection to the contributing factor, and again, should be able to relate to a implemented control measure. One way that we can get to the potential or the environmental antecedent is using a method called asking the 5 whys. And we'll go through and exercise that in a moment. But as we work through the people, economics, equipment, processes, and foods, here are some of the examples, some of the more common examples that you would find in environmental antecedents. And this scale here is kind of blended together for a purpose because some of these environmental antecedents have overlap. Food and processes are pretty specific. If you have a food that needs to be changed or the ingredient needs to be shifted to reduce the risk, or the process needs to be refollowed or changed or updated or a new process, those are kind of pretty specific. If you have a piece of equipment that's inadequate or is not approved or doesn't work for a certain task, again, those are more specific as well. But as we move into the economics and people, or lack of training or lack of funding or monies for updates and repairs, et cetera, can affect everything. So they're a little bit more ambiguous across the scale, whereas equipment, processes, and foods can be a little bit more specific. But I'm not going to go through all these examples. But yeah, this is the different 5 categories. Now let's work through the 5 whys and applying the 5 whys process to getting to the root cause or causes of a contributing factor. So our contributing factor in this example is insufficient cooking of ground beef, which is an S1, contributing factor survival 1, was identified. And the first question is, why was the raw hamburger beef undercooked? And the response, a new pizza deli worker was assigned to the cook line that night and undercooked the food. The next logical question, why did the pizza deli worker undercook the food? The worker stated they weren't well trained on the grill prior to that evening. The next why question, why was the pizza deli worker not trained properly? The manager forgot to go over the basic cooking protocols with the pizza deli worker that evening. Why did the manager forget to inform the worker of the cooking protocols? The manager was overwhelmed due to the shortage of staff that evening. And why was there a shortage of staff? If we drill down even that next layer, manager states they can't really compete with the salary demands, etc. All right, so this is the next poll question. Which of the following environmental antecedents best represent the poorly trained and managed pizza deli worker and the staff challenges? And again, these are just going to be the broad categories. A is food, B is people, C is economics, and D is people and economics. All right, let's see what we've got. People and economics at 69%, food at 2%, people at 25%, and economics at 4%. So we probably have a good idea. It's either going to be people or economics. And not the food, and changing the food to fix the problem. Training the people could fix the problem. Economics, it sounds like there was an economic issue. So I'm in agreement that people and economics would probably be the two that we could that would most likely apply to that to this scenario. So let's look at this scenario again. And so if we look at why did the pizza deli undercook the food, the worker stated he was not trained properly. So there was poor training, which applies to a people issue. And then we have why was the pizza undertrained? There was a lack of a managerial oversight in that particular process. So the manager should have been on top of the training, orientation training or beginning training of their staff members on these key critical food safety operations. And then finally, the manager mentioned that there was some economic concerns or challenges with getting enough staff to properly do their job. So economics was another factor or environmental antecedent as well. So all of those would fall under those two categories of economics and people. So if we look, and here's some more examples, and I want to highlight the processes and the food because that's what we haven't talked about. I think people issues are pretty straightforward, and economics are pretty straightforward too. I mean, as I said, almost all contributing factors have a people element and probably an economics element involved. But the food, equipment, and processes can be a little bit more distinct. For example, in this salmonella outbreak where raw eggs were used as an ingredient for dressing, changing the food or maybe using a pasteurized food would fix the problem. So the root cause could be indicated as a contaminated food or contaminated food used, and fixing that would be replacing that food with something that's pasteurized. So changing the food, for example. The norovirus outbreak, poor hand washing due to a lack of kitchen hand sink, and that's a clear issue where we don't have enough equipment to properly do the job of hand washing. So equipment would be a factor there, and changing or replacing or adding a hand sink would be the corrective action. And then finally, on processes, we have a Biserius outbreak, identified, inadequate acidification of sushi rice. And this was a process that wasn't properly followed. So the process was being performed improperly. So that would be the fix would be establishing a process that works and following that process. So here again, these are some of the other examples, and there are a myriad of examples and different types of environmental antecedents. Again, the key is once we identify or have a good idea of what our contributing factor is, then asking the 5 whys, or trying to understand why that contributing factor occurred, getting to the bottom of that contributing factor. And that's going to be very, very important, again, in establishing control measures that are specific to that environmental antecedent as well as the contributing factor. All right, so let's jump into the environmental assessment. And I mentioned environmental assessment being this kind of narrow focused assessment of foods, processes, people at a point in time and at a point of service. The environmental assessment, a more formal definition, is it is a systems-based component of a foodborne illness outbreak investigation that fully describes how the environment contributed to the introduction and/or transmission of agents that cause illness or could cause illness. So there's a lot of different steps, a lot of different activities that would be appropriate during an environmental assessment. Now, we don't always do all of these things, but most of the time we are going to do pre-preparation or preparing in advance to go out and do an environmental assessment. Most often we're doing it in interviews and observation. We may do sample collection. We may not do sample collection, depending on the type of outbreak. There's usually always some degree of record collection, and also control measures being one of our main goals is to get that control measure in place. And then the final reporting. We have varying degrees of environmental reporting that takes place during outbreak investigations. All right, so assessments are always going to be data-driven, depending on what we know at the point of going out and doing an assessment. Will always be limited to our information in terms of how and what we can do. Obviously, if we know the pathogen, that's great because we can begin to focus. If we know the food, that's great. We can begin to focus on that food. But often we don't have that information. We have very limited information, especially if it comes in through complaint surveillance. And we're going out. We can't wait for epi studies and lab analysis to be conducted before we go out to do environmental work. So sometimes we have to go out with limited information. It's important to understand that often environmental assessments may be at several levels, where we go out and we do the first level of environmental assessment. Then when new data come in, new information come in, either through epi or lab, we may have to go back out and do more work, environmental work, in terms of looking at different foods or processes, et cetera. And an important point to make here is that we form a environmental hypotheses early on, and we have to remain open for that hypothesis to change as new information comes to us. All right, so when we prepare for the assessment, we want to conduct with our outbreak team. Again, that's the epi, the lab, and of course the environmental. We want to try to understand as best we can, or even hypothesize, what the causative agent might be. What's the illness onsets looking like if we have that information? What's the likely exposure dates, meals, and the locations, and build a working hypothesis off that information. We want to collect food we want to collect food establishment information, and we can do this before we even go into the location. You can go online, you can look and see what their typical menus or recipes look like. We can also look at existing regulatory records, old inspection reports, information that might be helpful in terms of understanding what types of patterns might exist at this location. Looking at the menus, recipes, and formulations. Again, anything available online could be helpful in that regard. Relationships between other chains or other restaurants. Do we have restaurants that are part of a chain? Do we have employees being moved from establishment to establishment, or foods being used in different establishments from the same source? And we would want to also consult with the routine inspector. So that inspector likely spends a fair amount of time in these locations, and we want to make sure we get them involved in this process if they're not already. They're also going to have a working rapport, hopefully have a good working rapport with the owner-operator of the establishment. They're going to understand the layout. They're going to understand some of the more detailed intricacies of the establishment that can help even before going into the location. Preparing a checklist can be very helpful. Some of the things on that checklist might be unusual events that may have occurred, equipment failures or repairs, making sure we understand if changes in processes foods or operations have occurred, employee or customer feedback, making sure that we're looking for any information about customers, additional customers, or employees that might be associated with the contamination or the outbreak. And again, related food processes, food or condition changes. There's also a manager interview that usually takes place, often at the onset of our environmental assessment. As I mentioned earlier, it's important to have a rapport with that manager, and often having the routine inspector being part of this assessment is vital to establishing or helping maintain that rapport. And it's also important to inform the manager the purpose of the visit. We don't want to accuse or make accusations to the establishment. We just want to get to the bottom of what happened, if anything happened. We also want to avoid leading questions or having a bias moving into the investigation. It's always best to ask open-ended questions. For example, we don't want to say, how do you sanitize the table? We probably want to say, how is the table cleaned and sanitized? Or even if you don't want to use the clean and sanitize, you may even ask, what happens between this activity and this activity, or does anything happen? And keep those questions open. We want to consider communication barriers. This is very important. If there's language barriers, have a plan for that. If you have employees that may be able to speak the predominant language, that can be very helpful for interviews, or have a language line if you have that access to that. You want to be prepared for other questions too. So be prepared to provide some feedback on the outbreak, general information, but keep in mind that specific information about illnesses can be HIPAA protected. So we wouldn't want to share any specifics about identifiers of cases or individuals who may be sick. There's also an observation that usually occurs during an assessment, and this is the going in and looking at things and looking at systems and processes. It's best to do this with the presence of the manager, because there's likely going to be questions that we have as we go through this process. We want to understand the general layout, the flow of the food and the systems. The routine inspector can help there, but also the manager would help too. We want to collect objective data as best we can. So we want to be able to try to get as many measurements and specifics that we can along the way. And then we also want to make sure if we have a pathogen-driven response, that we're really focused on specific things associated with that particular pathogen. If we don't have a pathogen-driven response, then we may have to keep things much more broad. And again, going back to looking at what information we have from our EPI interviews, if we have any lab information, and again, forming that hypothesis using that critical thinking and determining where we're going to focus. Otherwise, we go into a big kitchen, and where do we even begin? It can be very daunting and challenging. And we'll talk about outbreaks where we don't have a lot of signal and we have to make some kind of broad summations. So we'll talk about that in a moment. All right, so most establishments have a flow of how the foods move through the establishments from receiving to service. And it's a good idea to have an understanding of how these foods move through the establishment, in particular a food that we might be investigating. So if we're looking at one particular food, we want to understand how that food moves through that establishment. And there's another way that we will use specific food flows for a particular food. Now, food flows can be very valuable during outbreak investigations, and they're valuable in complex multi-food ingredients or multi-day preparation, especially, so we can kind of wrap our brain around what's in this food, what steps does it go through, and it provides that insight into the people and the different processes, the different ingredients for each and every step. It helps us target specific steps that we may want to look further at and go back into the kitchen and say, hey, how do you perform this step for me? It can help rule out or rule in contributing factors, and it better allows insight into potential environmental antecedents. It just gives us a better picture. And we're also at that point when we're conducting a food flow, we're asking those questions. And as I mentioned earlier, some of those environmental antecedents or root causes will be gleaned through those questions that we ask when trying to understand how a food is built. And it can also, as I mentioned, it can help focus our control measures to a specific task, activity, or action. So when we look at the way foods flow through establishments, they can go through a number of different ways. All foods come in the back door typically and go out the front door, either in someone's belly or as a to go, right? There's a lot of different steps along the way that the foods may go through, and not all restaurants go through each and every one of these steps. So it's important to kind of map out what steps, whatever food we're specifically looking at, which steps that they actually go through. And for each step, we want to know the location in the facility where it took place, so we may go back to that location and investigate. We want to know specific ingredients, all ingredients. We want to know the time of day and how long did that process take? How long did that step take? We also want to understand critical limits, or those things like cooking temperatures or times, or how any kind of acidification measurements, etc. So any critical limits in that step, what were they? Were they being monitored or evaluated? And then we also want to understand the equipment used. Again, if we want to go back and see how that equipment was used, how it was cleaned, sanitized, etc. And then finally, those people involved. We may need to talk to those people. We may need to interview those people, understand more about what happened. Now, this next example is a food flow example that was actually built during a foodborne outbreak investigation. And the point for putting this up here is to kind of show how a food flow can kind of develop. And it usually starts with a blank sheet of paper and you're making notes as you move through the process. And as you make these notes, you find little things and questions, and you realize, hey, I'd like to know more about this, or I'd like to know more about that. The purple you probably can't read on the screen, but the purple was eggs at the top, and it was a raw shell egg. And it's like, well, we know we've got raw shell egg going into this. We know it's a potential bacterial outbreak, salmonella at the time. And how did were these eggs cooked, or were they served raw in this as an ingredient? And going back and understanding that A, we had this stealth ingredient, eggs, and B, where was it cooked? Where was that cook kill step at? Was very important in a overall complex menu item. So putting it down in writing, and sometimes it doesn't look as neat and as we would like, but you can sort through that as you make notes. You can kind of clean that up later, and we've got a good example of food flow that looked like this initially, but got cleaned up so you can make better sense of it. So when you see those things, like in this particular example, you see those eggs and you say, well, where was it cooked? And you say, well, it was boiled right there on that. I think it's the second purple indication there. What we want to do then is go in and reconstruct events. So going back in and saying, hey, how did you do this? Walk me through the process. Now, some of this reconstruction can be done through interview, but it's best to do it while they're actually building or making the product, because then you can take measurements and you can see if in fact they're meeting their critical limits, if there are critical limits associated. And then you can see what kind of deviations, you can see what the response is. And you can also verify that, hey, this is what they say they're doing, but actually when they went in and performed the task, they're not quite doing this to that activity. In the previous example, that food flow, they said they were boiling the food to achieve a cook kill step of those eggs, but in fact they were not. They were pan searing the product, and the product was not reaching a cook kill temperature. So it's a great example of going back in and reconstructing events and finding that breakdown in the cook kill step. Excuse me. So other activities you may want to consider when you're reconstructing or having them build or conduct a process is the employee interviews, taking food samples or environmental sampling, and records collection. If they do have any records where they took temperatures or did any type of monitoring, making sure you're collecting that information. Now, another step in this process of environmental assessment is conducting interviews. And we have manager interviews, and we also may have employee interviews. If you're doing employee interviews, they really should occur as soon as possible. Meaning, if you're out there the first day and you have the opportunity to interview an employee, and it's appropriate, and you've decided to do employee interviews with your team, then I would recommend doing it as soon as possible. If you wait a few days, information stories may change, as you might predict. You want to make sure you target the staff who made the implicated food, but you may have a more broad where you're, interviewing all the employees. Let's say we have a norovirus outbreak, and we want to make sure that there wasn't an infected worker who was working, or a worker who maybe had infected family members. We want to, again, ask open-ended questions. Use the food flow to assist. If we can understand which employees did which activity, then we can focus those interviews. And also keeping the interviews private. What I mean by that, sometimes it's best to interview the employee separate from the manager, because you might get a different response when you do that, if that's possible. Take detailed notes, because again, sometimes things can change over time. If you interview the employee twice, you might get different responses as time goes on. And then finally, we may have to conduct employee interviews at a later time. Again, this should be a team decision in terms of to what degree employee interviews will be conducted. Sometimes epidemiologists want to do the interviews, and they want to have a more comprehensive interview instrument available when they're doing those interviews to avoid redundancy. So again, it should be a team decision on employee interviews. And as I mentioned earlier, employee data and illness data in particular are always subject to HIPAA protection laws. All right, so next poll question, because we're going to shift gears a little bit and go into sampling. Have you ever collected environmental samples? And when I mean environmental samples, I'm talking about, here I'm talking about surface sampling, water sampling, food sampling, or stool specimen collection. Right, and about 58% yes and 42% no. So yeah, that's a pretty significant number, 42, having no sample collection of any of those things. And I would imagine that if we narrowed that down to specifically surface environmental sampling, it might even be much lower than that, which is really not surprising. At least in Tennessee, our environmental sampling really, surface sampling did not truly begin until probably about 2015 across the state, at least until we formalized an environmental sampling protocol. So we are relatively new to that game. We've done food and food, water, and stool sample collection for a number of years, but environmental sampling not so much. So it's relatively new. When we think of sampling, again, we got those 4 buckets: stool specimen, food samples, water samples, and environmental samples. And I'm going to focus right now on environmental sampling. And what we're talking about here is surface sampling. So with environmental sampling, it can be a very powerful tool to help establish that link between the point of service or the environment with the cases or the illness. And with whole genome sequencing, relatively new technology, it's even more valuable, because we know genetically if the salmonella is linked to the salmonella in the clinical culture or the clinical specimen. It could be much, much more definitive in terms of making that connection between, let's say, the establishment and the illnesses. Before sampling is done, it's important to collaborate with your lab to make sure that you have the proper methodology, the proper types of tools and instruments, swabs and materials, that you have the ability to transport safely and and can keep the integrity of the samples, and also that you have a chain of custody form appropriate for environmental sampling. During the outbreak, it's important also to communicate with your lab with if is sampling appropriate. Should we be sampling? How many samples are we going to collect? Some labs will allow more than others, depending on their resources that they have. And when to expect deliveries. Usually outbreaks begin on Fridays at 4:30. That's a big concern if you're getting samples at Friday at 6 p.m. Can you get those to the lab? Is there a place that the lab can take those samples, et cetera? And confirm again the appropriate methods of delivery, whether you're using a courier, you're delivering in person, which labs it going to, et cetera. So all these things really need to be planned out before, and some things will need to be discussed during outbreak investigations, or at least at the onset of the outbreak investigation. And planning what to sample, where to sample, and when to sample is going to be very important too. It's going to be based on that coordination with your epi and lab information. Not all foodborne outbreaks get environmental sampling conducted. So it's going to be very dependent on the circumstances where that sampling can provide a value to the investigation. If you have an outbreak where you have an infected worker identified, it's a norovirus outbreak, unless you're trying to understand what degree of contamination occurred in that environment, most likely you have the source of the contamination and you have control measures that can address that. So understanding whether whether the virus is still present may or may not be helpful. On the other hand, you may have an event where you have an ongoing outbreak of, let's say, salmonella over the course of years coming from the same environment. Going in and trying to find that salmonella in that environment is going to be very critical in terms of getting controls put into place. Your supplies should be sterile. The swabs and sponges are typically the instruments that are used for environmental sampling. And those are some examples of the devices that we use currently in the illustration to the right. And we want to make sure that these equipment aren't expired. We have a program in Tennessee where we manage all of our supplies across the state. And we make sure that those supplies are A, in date and not expired, and B, readily available anywhere across the state as they may be needed. And we also have some just-in-time training that we provide for staff members going out. We provide support from central office for doing sampling, and I encourage, if you have a sampling program, to consider those types of options. Depending on the type of sampling, is it going to be something that's aseptic sampling where you may have a sponge that you have to use a gloved hand with? We're always using gloves, but if you use a sponge that you're touching the sponge, then that glove has to be sterile. And so there's a whole process of donning and doffing gloves and ensuring that sample remains aseptic. And those are considerations with the tools that you're using. And you should have a team to do sampling as well. Typically, or ideally rather, it should be a 3-person team, the sampler, the sampler's helper, and the scribe. And I can't tell you how important that is, especially if you're doing a number of samples, because it can be very burdensome and time consuming conducting samples if you're by yourself or even with just 2 people. Food, water, and stool sample collection, kind of put those all together, but they're very important nonetheless. Again, just with environmental sampling, you want to have a plan ahead of time, the appropriate forms, necessary collection tools, appropriate training on collection methods and how we're going to collect it without contaminating the product, and also logistics, considering how we're going to get that sample back to the lab to ensure that the integrity is maintained. We want to hold food and water samples on occasion when we go in initially to do an investigation. We may not have the green light to collect food and get it to the lab. So how do you hold that food? What methods do you use to make sure that food is contained? Do you take possession of that food or do you place a hold on it with documentation, et cetera? Those are things that really need to be ironed out ahead of time. I've got a lot of good examples. I shouldn't say good, they're really bad examples of not taking possession of the food sample and it disappearing over the weekend. And not having that food sample could have made a big difference in the outbreak investigation, or the outcomes of the investigation. So have a system or have a plan in place ahead of time. Consult with your laboratory services as always. How much sample, what state does the sample need to be in? If it's frozen, it stays frozen. If it's unfrozen, it just needs to stay refrigerated, etc. And what those temperatures need to be maintained at during that storage, during transportation or holding. So make sure you consult with your lab on those specifics, and then communicate with partnering agencies if there will be sampling going to other agencies, specifically to like federal agencies, and the labs can help us do that typically. Also, in part of environmental assessment is record collection. There's almost always record collection taking place. What records do we need are going to be the big question, and that should be a question that is answered, or at least partially answered, at the very onset of our investigation with our outbreak team. So we're speaking to our EPIs and saying, hey, what do you need? Do you need anything to do active case finding? Do I need to get more customer information? Do I need to get more information on specific foods, sources of foods, etc.? Those are questions that, again, the team will need to work out long before we go into the establishment. Sometimes these things happen where we don't always get to have those robust conversations, and there may need to be some communication after the fact. And sometimes we have to go back into the establishment, get more information on a specific food or other specifics within that establishment based on the agencies, or based on EPI or labs or other partnering agencies' requests. Then collecting records should occur as soon as possible. Again, sometimes these things may disappear. So day one, it's good to get any records that might be needed during the assessment. And then making use of cameras can be helpful. Sometimes we don't take back hard copies of records or any hard copies at all. We use digital cameras, and we can take pictures or images of boxes, barcodes, other information, and then share that with our investigating partners. It's always best to be careful of branding and taking images of individuals, employees, etc. So beware of that if you're using a camera. Just make sure that that's something in advance to your investigation that you've planned and you've worked out which camera you're going to use. Is it going to be a personal camera? Is it going to be your government-owned camera? And then some of those, what size images can we use so we don't have problems emailing. Those sorts of things, again, should be flushed out. When it comes to that record collection, there's a lot of different records that we might collect during an environmental assessment. And the main records that I have listed here are going to be things like the menu, receipts, food labels, invoices, catering information, third-party delivery services can be very helpful for EPI folks. Temperature logs, acidity logs, other types of sanitizer logs that might be present could be also helpful. Illness policies, if they have illness policies in place, employee names, attendance records, sanitation, food policies, food preparation policies, and even the number of meals served during the time period in question, excuse me, could be helpful information. So bear in mind that there's a lot of records that might be collected. So again, at the onset of the investigation, these are conversations that should be had among the team. Excuse me, losing my voice. All right, let's shift over to one of the most important parts of an environmental assessment, and that's putting in control measures. And we put these control measures into two groups, short and long-term controls. Short-term controls are those immediate things that we do during an assessment, like holding, seizing, issuing a closure notice for an establishment, food embargoes, etc. Long-term controls are just that. They're usually things that occur in the long term, and they usually have more long-term effects, such as implementing a risk control plan or a HACCP plan or implementing training. modifying menus or foods or processes or equipment changes. So these are things that are typically in the long-term category. Risk control plans are something that Tennessee uses quite often, and the risk control plan is going to be one of those well-defined specific plans for an activity or process that guides the operator through the process of identifying what the problem is and identifying methods to ensure that the issue stays in compliance moving forward. Another tool that can be used is tools that help us understand how to restrict or exclude ill food workers. And I want to direct you to the FDA's tools that they have. And it's not the image that's on here, but if you go um, to their website, and I have a link there, but that's not very helpful unless you can click on that link. But the FDA has now a virtual a virtual guide that you can go through and navigate through this very complex, convoluted decision-making process of exclusion and restriction based on an employee's diagnosis or their symptoms, and that can vary, and it can be very, very challenging. So I'd encourage you to use that resource. It's a wonderful resource. I've used the one there that's on the screen for a number of years. It's been very, very helpful. It's a very challenging concept of that putting that control measure in place of restriction or exclusion can be very challenging. All right, so I mentioned earlier, sometimes we don't understand the contributing factors. We don't have a clear contributing factor identified. Then what do? Then we kind of have to take broad control measure steps. Those broad control measures are probably going to encompass one of these 5 areas of hygiene, time temperature control, contamination of equipment, inadequate cooking, and then making sure all the foods are sound and from a approved source. And again, we would put in these broad controls when we don't have something specific. Ideally, we're identifying a specific contributing factor and focusing that control on that contributing factor and those antecedents that led up to that contributing factor. But sometimes we have to acknowledge that we have these outbreak investigations where we just can't determine that specific contributing factor. We kind of have to make those broader control measures. So do keep that in mind as you're going through that process. And finally, we have communication of findings. So to a degree, environmentalists are reporting their findings. They might report them daily or throughout their environmental assessments, and they also may be part of more formal reporting in different types of formal reports that your agency may be involved in. And I'll talk a little bit more about some of those in a moment. It's important to make note that your documentation in terms of your assessment and your reporting may become evidentiary. So make sure that we don't have anything that we wouldn't want others outside of our agency to read. If it does become something that's litigated, we want to make sure that they remain professional, legible, summarize as best we can, and we also want to keep our team updated as frequently as possible. And then findings should always be summarized. All the details may not be as necessary, and have those general summaries for the broader, larger team. Contributing factor data should be consistent within these reports. Now, there's formal reporting, there's the NORS reporting or the National Outbreak Reporting System, and then there's the NERS reporting system, and I'll talk a little bit more about NERS in a moment. But those contributing factors reported in both those different reports should be consistent. So if we're indicating a survival 1 on one report by an epidemiologist, that survival 1 should be in the NERS report and vice versa. So we want to make sure that those contributing factors make sense and they're consistent. That's very important to understanding and studying foodborne disease across the board over time. If we have inadequate or erroneous data, it's not going to be very helpful in trying to pinpoint what's causing foodborne illnesses. And then finally, environmental data and epi reports should match that's the same point. Pardon me. Okay, so let's jump into the NERS. All right, so the NEARS data collection. NEARS is the National Environmental Assessment Reporting System, and if you do participate in the NEARS data collection, which I encourage you to do so, ensure that you're collecting the data in a timely fashion, and that data again is consistent with your other reporting. The NEARS data, if you're not participating in NEARS, I again would encourage you to do so because it is valuable to overall understanding of what's causing foodborne outbreaks across the country. And we can take that data and look at these things and study this information. If you're not collecting it, then we don't have that data to understand. So it does provide information that what could have contributed to outbreaks, and it is something that is reported by local and state officials when they're doing or conducting foodborne outbreak investigations. If you're part of those program standards, the FDA Retail Food Program standards, it can help meet standard number 5. An important point to make is if you're using NEARS, it is not the environmental assessment. Now, it can contribute to and facilitate the environmental assessment, especially the manager interview sections. But it is not to replace the environmental assessment. There's going to be activities that will likely be unique to each individual assessment that'll have to be conducted that may be a little bit more broadly represented in the NEARS data collection. And then NEARS is a 7-part formal data collection instrument. So again, I encourage you, and if you'd like more information, you can reach out. You can reach out to me, or you can reach out to others that we have links to for more information about NEARS data collection. I'm going to shift over quickly into traceback and traceforward investigations. This is not something that always happens during foodborne outbreak investigations, especially those local outbreaks that might not be source driven. But if they are multi-state or multi-jurisdictional outbreaks, it is important to understand that traceback, traceforward investigations can occur. The purpose of these is to determine the source of the contamination, and they also facilitate recall efforts. In doing this process, you may find additional cases, and that allows us to test our hypothesis about the source. You have 2 categories of traceback investigations. One is the investigational traceback investigation. The other is the regulatory or formal traceback investigations. Now, an investigational traceback is one that's typically done by a local or state agency. That's very informal, and it's rapid source tracing. You probably will need, or most likely will need, lab, epi, and/or environmental evidence to initiate that type of traceback investigation. So, for example, if you have a local source of food, like let's say eggs, going into an establishment, and you want to understand that where those eggs are from your local source are going to came the source of those eggs, and then perhaps where those eggs are also going to in your region. That egg supplier might be supplying other restaurants that might need to be looked at, for example. But typically these stay within that state or within that region. They don't involve our federal partners. Now, when we have regulatory traceback investigations, those will involve our USDA or FDA partners. And these traceback investigations may go across the country. They may be international as well. So that traceback goes back to the source, and then they move forward again to identify additional implicated establishments or points of service, and also additional cases. So that is very briefly the overview of traceback, traceforward investigations. And one of the things that's important for us to understand at the local and state levels is what our role is in these investigations. Our role could herald a multi-state investigation, and we want to make sure that we have an implicated food. We want to rule out point of service contamination. So those things have to happen before larger traceback investigations will occur. So that is the boots on the ground. We may have to interview cases for product details, and we also may need to collect records, paperwork, receipts, invoices, and provide that to our federal partners. And it's also very important to ensure that we have quick and efficient communications of our findings to those partnering agencies. All right, so poll question 6. Which of the following must occur before a regulatory traceback investigation can occur? two occurs in the same question. So this should be pretty easy. So all right. Do we have some totals? All right. Yes. Okay. 78% of folks said all the above, and that is correct. We want to make sure that we have a food ingredient implicated. We want to make sure that there is a connection with the point of service and that food, so that people did consume or did purchase the food from that source. And we want to make sure that we rule out point of service contamination. So, for example, if you're dealing with a scombrotoxin outbreak, you want to make sure that the time temperature abuse of the fish didn't occur at the establishment. If it occurred at the establishment, then it may not be necessary to trace that fish back to understand if time temperature abuse occurred during transit, during harvest, etc. Okay. All right. So I have one slide on recalls and product recalls, and it's not going to spend a lot of time here. We have the three basic classes of recall, where we have a firm-initiated a call, and we have FDA requested a call, and then recalls, and then we have now mandatory recalls. So the different classes of recalls, class 1, 2, 3, based on the severity. Class 1 we'll call serious adverse health effects. And then class 2 is the probability of serious adverse health effects, is remote, and then the product is not likely to cause adverse health consequences, but it could be a quality issue, etc. So those are your three classes and recalls that can occur. And at the local and local and state levels, I guess fortunately we're not involved in that much recall activities. This is a more of a federal activity and industry-driven activity. But I think it's important to kind of understand the differences in the recalls. This last slide here has some resources that I mentioned earlier, and the integrated Food Safety Centers of Excellence, or COE for short. There's a lot of resources there for conducting foodborne environmental assessments. The Environmental Health Specialist Network, SNET for short, again, another valuable resource with a lot of good information for conducting environmental assessments. I know there's the EATS training, the 101, 102 EATS, which is a virtual environmental assessment training. I encourage you to check that out. Of course, the Food and Drug Administration have tons and tons of resources. That employee health policy tool is relatively new, wonderful tool. I'd encourage you to check that out. Association of Food and Drug Officials, again, another organization with tons and tons of valuable resources. Council C4, or Council for Improvement Foodborne Outbreak Response, and their guides, again, wonderful tools that I encourage you to check out. So for the remainder of the time, which I don't have much left, I'm going to go through an outbreak and apply some of these principles in this outbreak. So I'm going to talk really quick through this outbreak, but hopefully some of this will be, some of the things we talked about will be driven home with this particular example. So this example involves an outbreak in 2020. It was a chili cook-off or chili competition outbreak, and the pathogen was Salmonella muyinchen. The outbreak occurred in the great foothills of the Great Smoky Mountains, and it occurred in the fall of that year. Now, how this outbreak was identified or made known to our department was through the USDA, through their electronic consumer complaint form. Came in with a complaint of some folks out of state that attended this chili cook-off in Gatlinburg, Tennessee. That came to us, and then we initiated an investigation. Now, a little bit of background. This is a one-day event. It's a competition happens on November, in the middle of November. This year it was the 12th, on the 12th. It operates from 5 p.m. to 8 p.m. in the evening. Has a 30-year history. In this particular competition, there were 13 different vendors. All these vendors were from approved, licensed, permitted establishments. So we didn't have any persons building stuff at home or anything like that. And there were over 1,000 consumers or participants in this particular event. The EPI investigations kicked this outbreak investigation off. So we were doing an EPI work before we were doing environmental work, which is sometimes unusual. But in any event, we contacted the Chamber of Commerce, acquired a registration list, and then mailed a questionnaire to the participants. We conducted case control studies, univariate, bivariate, and multivariate logistic recession analyses. So all that was done to try to help us determine which of the 13 restaurants was most likely associated with these illnesses. A case, by definition, was someone with salmonella-like symptoms. And November 2013 to 24, they attended the chili cook-off. And this is our EPI curve. The event occurred, as I mentioned, on November the 12th, and you can kind of see this curve of the most cases occurring around the 13, and then they start tapering off, probably most likely secondary cases as we move down further out. And as far as our EPI analyses and the exposure analysis, we can see that our odds ratio for restaurant D was 3.21, which is significant, as well as our p-value of 0.00006, which is very significant as well. So there's some other significant foods on there. I think you can direct your attention to restaurant C, having some similar statistical value. So we did other analyses. Our multivariate analysis, however, if you can look see here, restaurant D really stands out at that odds ratio of 3.5. The confidence interval, 95% confidence interval between 1.23 and 9.4, and then that p-value at 0.0188, which kind of sets it apart from the other locations when we look at this data across the board. So we have a location, Restaurant D, that we're going to focus on. Our event happened on the 12th. This is kind of a crude timeline, but you can see here our environmental assessment didn't happen until December the 8th. So we've got a lot of time between November the 12th and December the 8th. The good news is this is a one-time event, so they're not continually doing chili production, at least at that scale. So it was that the event happened, it's over with. So the likelihood of ongoing transmission or illness is low. But these are the steps that we took. Also important to note here is the length of time and the length of or the number of visits to the location. Environmental assessments are not always a one and done. We have to usually go out and follow up, if nothing more than to ensure control measures are put into place. This environmental assessment focused on observation, interview, and food flow, and we did collect data for NEARS, as Tennessee has been doing since NEARS was developed. Some of the characteristics of this establishment that were unusual: small kitchen, large quantity of food, 4-day production, and as we will learn, inadequate equipment being used. Our working hypothesis was a potential salmonella survival, contamination, or proliferation in the chili or an ingredient in the chili. So we're kind of focused on chili, obviously, and salmonella, how salmonella could contaminate that chili. This is our food flow. This is a cleaned up version of that food flow. There's a lot of things going on here, but I want to direct your attention to the ground beef, the pork sausage, the red onion, and the pre-processed ingredients. That's the beginning of the food flow. And as we move down this food flow, day one, we're going to brown the meat. This meat comes in raw. We're going to brown it, drain it, cool it. Then day two, we're going to cook it. We're going to containerize it, cool it. That's day 2 and 3. And then day 4, we're going to, day 4 is the competition day. We're going to reheat it, we're going to hot hold it, and basically serve it. All right. So in those steps, very quickly, which of those steps would we focus on the investigation? So we got steps 1 through 14. I've distilled it down. Which ones are we going to focus on? All right. What are we seeing here? Very good. Very good. 73% said all steps. At this stage, all steps are going to be a focus. Now, cooking, cooling, absolutely. Hot holding, absolutely. These are very risky activities. That could be our low-hanging fruit, but definitely we don't want to discount any of these steps until we can investigate each one of them. So very good. All right. So again, yeah, we're going to look at all steps. We're going to look for contamination, proliferation, and survival, those broad categories of contributing factors in each one of these steps. Now, if we look at this first step, browning, the browning took place in this steam table. This is a steam table that's used for holding foods, not intended for cooking, as we all well know. So that was a browning process. It was not fully cooked at this step. It wasn't intended to be fully cooked, according to the manager. The next step was cooling in the containers, these big buckets, in the walk-in cooler. I think we could probably all agree that there's some concerns there using these types of buckets and using buckets in general this deep to cool foods. They were not cooled in an ice bath. They were cooled directly in the walk-in cooler. And then they were cooked the next day, as I mentioned, in that same unit. And this was cooked to a temperature of 165, according to the manager. And then they were put back in those containers and put back in the cooler for another cool down in the walk-in cooler. And then they were reheated on the day of service and then held at the point of service and then served. The holding at the point of service was not as big a concern because of the limited time the foods would have been there, but certainly reheating might be of concern because the unit they were using to reheat was one of those warming cabinets that does not have the ability to conventionally cook. So it would not be approved, or a piece of equipment approved for reheating, just holding only. All right, so if the chili was fully cooked and the verified temperature is 165, as the manager stated, how do we have large amounts of contamination make its way into the final product? And that's a big question that we had, and getting to the understanding the food flow really helps us with this. Because what we learned is there's this stealth preparation step, if you will. We're draining and containerizing, and then we're cooking the food, and then we're putting it right back into those containers. Those containers were not getting sanitized. So that's likely how we were able to keep a lot of salmonella in the product. And salmonella probably grew in that first cooling stage too. So this was an opportunity that we could show that, hey, we've got to make sure that if we were using the appropriate containers in the first place, but they have to be cleaned and sanitized between this par cook step and this cooling and the cooking step and going back into those containers. So that's, again, illustrates the value of mapping these things out and trying to understand all these intricate steps so that specific control measures can be put into place. So these are our contributing factors that we have: and proliferation, survival, contamination, and the cooling, the cooking, the containerizing or lack of cleaning and sanitizing, cool down or cooling, lack of cooling, and the potential reheating. So we've got, in all of our investigating findings, we have improper use of equipment. We have inadequate equipment available, poorly executed food handling process, and a lack of training of specific processes. So this was understood through why these things, why the contributing factors occurred, and through the interview. This is what we understood. So given improper use of equipment, inadequate equipment availability, and poorly executed food handling practices and lack of training, which environmental antecedents should be addressed? All right, this hopefully makes sense at this point. And let's see what we've got. Okay, so we've got equipment and processes at 9%, and then we've got equipment, processes, people at 32%, and equipment processes people and food at 33%, and equipment processes people, food, and economics at 27%. And there's really no wrong answer here. I think all the answers could be right. Now, what we found in our investigation, we didn't see changing the food necessarily as a control. So it could, in some instances, they could change the food and have pre-cooked food. But changing the food, probably not so much. The processes themselves, uh, um, we felt like those were contributing factors. I'm not advancing, sorry. So the inadequate use of equipment, the processes themselves in terms of cooling, storage and cooling, and then the people or lack of training would be the ones that we indicated. As I said, there's really no wrong answer here, as long as our control measure marries with whatever the environmental antecedent that we select is. So in this particular case, we put specific control measures for each one of these activities. So that help them make sense. Now, just to wrap up, the food environmental sampling, we had no leftover chili to sample. We sampled from 2 additional restaurants that came back negative, and collected 9 environmental samples as well, and some of those are images from those sampling. They all came back negative. The lab analysis in this particular outbreak, we had 6 clinical isolates, Salmonella muenchen positive with 0 to 6 alleles, which means they're very highly related. Food and environmental samples were negative. Now, here's the interesting twist. USDA does routine sampling, and some of their sampling isolates we found to be linked to our clinical isolates. Those samples were collected on September the 9th, 2020, and they were from pig intestines from the same firm where 100 pounds of sausage was purchased for this particular location. And the whole genome sequencing linked those intestine samples with our clinical samples. So we made a definitive connection between the processing facility and our cases here. So it makes it all kind of come together. So in conclusion, we had 528 individuals, 300 responded. That's individuals contacted, 300 responses. So pretty strong response. 99 cases, 175 controls, 24 different states represented here. So people from 24 different states. 4 hospitalizations, 0 deaths, thankfully. Restaurant D's chili was associated via our epi statistics. We had 6 patient isolates and 1 USDA isolate. They were all Salmonella muenchen positive, whole genome sequenced within 0 to 4 alleles. Now, when it comes to our contributing factors, we identified survival, contamination, proliferation, and survival in the inadequate cooking, reheating, cooling, and the lack of cleaning and sanitizing between raw and ready-to-eat activities. And then finally, we had environmental antecedents, improper use of and type of equipment, and proper training on specific processes. And we had targeted controls for those training and notes, trainings and notices to address proper equipment use or changing the equipment, and notices to address proper food preparation practices. So that is the conclusion of this talk, and I just want to make some acknowledgments and some of our contacts, the folks at the Tennessee Department of Health, and the various teams. And I like to keep it in teams because we all are a team, and all these groups are teams, and we couldn't do what we do without these teams and the players in these teams. So with that, I'll end the talk, and I don't know if we have time for questions, or if questions I haven't been following the chat, or other questions that may have come up.
So we have one question, Danny. Is it generally how we should collect samples when investigating an outbreak associated with a temporary event? Is this generally how we would do it, especially since food samples from the actual event would be difficult to get?
Yeah, I think that's a question for your team, and including the lab, and saying, hey, if we have samples, is it appropriate? And if we're talking about food samples here, if we have samples available, let's go ahead and get them. Let's have a method of securing the sample. Are we going to take it to our lab immediately? Are we going to hold it? How are we going to do that? What's that going to look like? But it's really a question between your team and at the very onset, if there's samples available, what do we get? And do we get them? And what specific foods do we want to sample? We may not have that information at that point in time, so we can't just go and take a sample of every food in the establishment or in that mobile unit. So we kind of have to have some signals on a specific food or foods. But again, I think the best answer for the person asking the question is it needs to be a team decision. And frankly, it needs to be something that needs to be discussed well before an outbreak occurs, what we might do in those particular events. Hope that answered the question.
Okay, I have one more in chat, and it says, how long has your EPI and food team been coordinating responses to outbreaks? Additionally, how was this collaboration initiated?
Yeah, so we work very closely within our food and enteric diseases program within the Tennessee Department of Health. That's at central office. That's been going on since I've been part of the health department, and I came aboard in 2003 with the local health department in Nashville, and then more recently moved to the state. But that's always been the dynamic where we have epi, lab, and environmental working as a team. And sometimes we have local health departments like in Tennessee, for example, you have their metropolitan cities that have their own epidemiologists, their own, well, it's basically their own government outside of Tennessee under contract with Tennessee. And we provide, that is Tennessee Department of Health via central office support to those contract counties. The rest of the regions across the state, we can usually take lead, and we have environmental health specialists in those regions, and we have epidemiologists in those regions as well. But we provide that support within our regions, within our contract counties. It's been going on since since my time, which is getting up there now a little bit, but that's yeah, and these are things that continue to develop. We try to continue to improve our relationships with our customers, which are our environmentalists, our epidemiologists, the lab, et cetera, and keeping that a nice tight cohesion, a nice efficient communication during outbreak investigations, understanding each person's role and what our expectations and goals of the investigation are.
Okay. All right. Well, thank you, Danny. I'm seeing lots of great job. Thank you. We appreciate this. I would have given anything to have had this when I first started as more of an advanced inspector. So thank you very much for that. If anybody has additional questions, please put them in the Q&A box, and that way this team can answer those as we move forward. We're going to take a quick 5-minute break, and we are going to put a timer up on the screen for you. So again, thank you, Danny, for bringing this great information and participating and sharing with everyone. We'll see you all back in 5 minutes sharp. All right, welcome back, everybody. I still want to say again, thank you so much for that great presentation. We really appreciate it. So I'd like to move on to our next set of speakers. I will mention that Daphne dropped a link in the chat box. If you want to download that, that's not for this presentation. It will be for the next presentation. But I am all excited to introduce our next two speakers, and our topic now is TCS food or not. So our first speaker is Adam Inman. He's the Assistant Program Manager for the Kansas Department of Agriculture's Food Safety and Lodging Program. He has served as the co-chair of the AFDO Retail Food Committee and served on the Package Labeling Ad Hoc Committee. He's been a Council One member for the 2023 Conference for Food Protection, and he was also a board member for the Manufactured Food Regulatory Program Alliance. Adam was also an IFPTI fellow. Congratulations on that. Our other speaker for this event will be Troy Huffman. Troy joined the Colorado Department of Public Health and Environment in November of 2015. And prior to being that retail food program manager for the state of Colorado, he worked for the Nebraska Department of Health and Human Services for 24 years. As a state delegate and executive board member of the conference, Troy has enjoyed participating in the process to help develop a food code into the document it is today. Congratulations to both of these guys for accepting our invitation and being part of our presentations today. And I'm going to turn it over, Adam, to you.
Thanks, Brenda, so much. I appreciate that. Kind introduction. And with that, we're going to kick off, pun intended, the TCS or not, you make the call presentation. There's going to be a lot of sports ball puns today for sure. So again, my name is Adam with Kansas Department of Agriculture. My colleague, co-host, color commentator, Troy Huffman with the state of Colorado, just to our west.
Hey, everybody. Great to be on here. Really looking forward to this. We had a fun time doing this in the last time and really looking forward to it. So several chats from some of my Colorado colleagues throwing in there. Really appreciate that.
Yes, wonderful participation already. Looking forward to this as well. So today we're going to review some film and make the call about whether a variety of foods are time temperature control for safety food or not. And if you are younger than I am, you might not remember the old IBM Presents You Make the Call series from football, where it's football time here, and from baseball. So I encourage you to check that out on YouTube. There's some fun clips where you get to make that call. Well, our goal line today is to improve our ability to identify and categorize time temperature control for safety foods. Inspectors every day, you know, you have to read the option and decide where to spend your time and energy during inspections. Requiring corrective actions for food that doesn't need time temperature control for safety may distract you from a food that needs more attention. So the objective of today's session is to enhance your skills in identifying those types of foods, as well as helping to characterize the risk that they may present. Not all risks are created equal. To reach that end zone, we're going to review the time temperature control for safety definition in the food code. We're going to review some tools to help us identify time temperature control for safety foods, review the relative risk of various TCS foods, and the most fun part of the presentation for me is seeing everybody's interaction and voting on whether food is TCS or not, and we'll have a little discussion about that as well. So kicking over to the food code, let's review that definition, time temperature control for safety food. Grab your copies of the food code and follow along. Time temperature control for safety food means a food that requires time temperature control for safety to limit pathogenic microorganism growth or toxin formation. It includes an animal food that's raw or heat treated, a plant food that is heat treated or consists of raw seed sprouts, cut melons, cut leafy greens, cut tomatoes, or mixtures of cut tomatoes that are not modified in a way so they are unable to support pathogenic microorganism growth or toxin formation, or garlic and oil mixtures that are not modified in a way so they are unable to support pathogenic Boy, I tell you what, Troy, that's a mouthful, isn't it? But that's
Sure is.
That's the legal mumbo jumbo that gets us to the end goal of identifying what foods do we really care about. We're not finished quite yet. the definition goes on to say that it includes, except as specified under subparagraph 3D of this definition, a food that because of the interaction of its water activity and pH values is designated as product assessment required in table A or B of this definition. So let's look at
That's
those
the part that I
tables.
find really, really interesting is the interaction between table A and table B, and to try to understand what that's all about. Go for it.
Sure enough, it is an important distinction, and it makes a difference in our work on the day-to-day basis, of course. So that interaction of pH and water activity in table A, we're talking about foods that are heat treated and then subsequently packaged. So Troy, what does that packaging do for us?
Well, that's going to end up happening is it protects that product from extrinsic environmental contamination that may have an impact. So that's one of the key elements that is the reason why these numbers, if you look at that, are a little bit different than what we're going to see in table B. So when you move on to that table B, you'll see why there is a difference between those two.
Right, so they're going to be heat treated and kill those vegetative pathogens, and that packaging is a cozy little cocoon to keep them safe while they're in their package. But as you mentioned in table B, they're not in that package, and maybe they're not heat treated as well. And so they have a different pathogen profile that we need to worry about. And therefore, as you mentioned, the numbers are slightly different. So these foods are not packaged. Also includes when packages are open. So more pathogens at play, Staph aureus, for example, Listeria monocytogenes. So Troy, why don't you walk us through some exclusions to this TCS definition?
Absolutely. You know, in the code, we've got to understand what those rules are to begin with before we can play the game. So that's why we wanted to review this section first, so we understand where there's that level playing field and understand all the nuances in identifying what is TCS and what is not. So here's some examples of some of those exceptions. I found this one really interesting, is that if you've got a hard-boiled egg that is air-cooled, and that is key, not put into an ice bath, where as it cools, it could pull that water into the egg. But if it's an air-cooled, hard-boiled egg, that is not considered TCS. Outside of the realm. For quality, we may be keeping in the refrigerator, but for time or temperature control for safety, not a concern. Same thing applies for those eggs. In the image you can see here, have that P on there, those pasteurized eggs, not going to fit that definition of time temperature control. So the next piece in the food code that we look at an exemption is going to be our hermetically sealed. There we go. Hopefully Adam would see my cue on that and move to that next slide for us. Those hermetically sealed. This is another exemption that's looking at within this. So those food items, here's some good examples. We've got some product that are packaged in bottles or canned goods. A lot of this would apply to canned or jarred goods. Commercially sterility within that. Now, once it's open, we're going to look at what that manufacturer might say on that, on how it needs to be taken care of for food safety on down the road. The next element that we're going to look at that would be an exclusion for the time temperature control is going to be those items in relation to, here we go with that table A and table B association. So we want to review and have an understanding of what table A and table B does for us, because that interaction of the pH of the product and the water activity of the product is going to help us define if it can be outside of that aspect of a TCS food or not. So those interactions are very, very important. And then the next element is those situations, lots of wording here, not going to read through this, but basically what this says, if you look back, sure, everybody's got their code book out and looking at that table A and table B right now. There's some parts with the interactions of water activity and the pH that would put us into a PA area. That is an assessment of that product that's going to need to be done. We're going to need to make that call to New York, have the officials in that room with all those monitors do that assessment for us on that product, is what ends up happening. So that can come into play in a lot of different forms. You're going to have a process authority is going to review that, possibly looking at the formulations, looking at the interactions, maybe doing some challenge studies, and help us identify if there's, in a lot of cases, there may be, if this is in-house items, a HACCP plan, some critical steps that need to be done or verified in order to determine if they're trying to make it so it's non-TCS. And then the final element that we talk about is, an example here with this picture and that last piece of an exclusion. So even though it may normally not be something that would support pathogenic growth or those formations or be exempt out of that parts A through D sections, there may be some external contamination that could happen just because of that isn't going to move that product for that potential into a TCS, time temperature control for safety food, in a situation like that. So that gives us a general idea of those exemptions. And one thing that Adam's going to talk about next is the Cliff Notes version. The quick hit guide that can help us is a very valuable tool for us to be able to make this assessment. So I call it the Cliff Notes version of this. It's kind of a quick little flow chart that Adam's going to talk about next.
Yeah, well, I want to build a little tension because I'm going to build off of what you just mentioned about the contamination and not becoming a TCS food at that point, because that time temperature control for safety is not going to change the fact that it's contaminated. And I think that plays off a question that came in the Q&A. Do you recommend referring to these as TCS or PHF, the old potentially hazardous food? And I remember back in the day when I was on the field, we were still under that PHF, and that created a lot of confusion for exactly this point. If it's contaminated, is it potentially hazardous? If there's a choking hazard, is it potentially hazardous? So I think this TCS designation really is good at telling us what are the specific controls that we're bringing to bear on that food item. Now, that said, of course, if your jurisdiction hasn't adopted that in your codified language, you got to use the term that is in your particular version of the food code. So an important distinction there. I appreciate that question. But now that we've got anticipation going, let's jump over to this job aid from the FDA that walks us through a real good way to, as you mentioned, quickly determine, is this a food we got to worry about from a time and temperature control for safety standpoint, or is it not? And so
Daphne just dropped that link into the chat. So if you want to go and take a look at that, it's kind of hard to read here, but yep. Thank you, Daphne.
Yep. If you got young eyes and can squint, you could probably make that out, but it's probably best to pull that up for yourself. And it's good to just have on the day-to-day anyway. But this summarizes all those words that I tried to read and Troy wisely skipped over. You can read those for yourself, but this just put that in a flowchart format and helps you get to the end result a lot quicker. So a big one there to call out is animal food that's raw or heat treated. Makes no distinction there for the animal foods. A plant food that is heat treated, that's an important distinction. So except for those ones that are specifically called out, the cut tomatoes, cut melons, cut leafy greens, sprouts, it says heat treatment is what makes that distinction. So you can get right to that green box of this is not a TCS food and understand that you can worry about other more important things from your risk-based perspective during your inspection. So going through that food, is it unopened, hermetically sealed, commercially sterile product? Is that canned good? And that's safe. Don't have to do that. Don't have to worry about that one until it's open, like Troy mentioned. So you can go through those and you're going to get most of the way down through a lot of foods and cover a lot of ground, but there is some wrinkles. So we'll get to that question that came in the chat here in a bit, but let's go ahead and talk a little bit more about, even if you do end up in a food being designated as TCS, not all TCS foods are created equal. So date marking exemptions, competing microorganisms, some of these things can come to bear on the food and say that certain foods are going to have different risk profiles from other foods. So just because the initial call is made that the food is a TCS, it does not mean that disaster is impending. You may need to evaluate what food code TCS interventions may be needed immediately during your inspection and which ones can be deferred to the second half while you make sure nothing else is more pressing. If, for example, the TCS food was not date marked, you need to make sure it's not one of the foods that's exempted from date marking. And remember that foods included in the date marking exemptions start from the standpoint of being considered a TCS food. Foods that will not support Listeria monocytogenes growth may still need temperature control to prevent other pathogens from growing, but we're not worried about Listeria monocytogenes. That's the whole point of date marking. So we can move on and not worry about that. Still need to be temperature controlled, but there's no hard stop after 7 days in the cooler. So a lot of times out in the field, you'll hear that establishments been holding the item that way as long as they've been open, 30 years or since my grandpa was running the business. And no one's ever said that before. Maybe, maybe not. But that could give you a little bit of an idea. I might have a little more time to work through this and get the A team behind me there to get that product assessment done or get some more information about the food, maybe call that corporate quality assurance manager and get some more information to support the determination. If the food is taken from refrigeration and held at room temperature, you have a little more time to let that process play out while you're getting that supporting information. But if it's coming out of hot holding or at room temperature to start with, there's less room for error. Those pathogens, they're human pathogens, and guess what? They like human body temperature quite a bit. So they like those warmer temperatures are going to grow a little bit faster. If you have bare hand contact, some of these other risky practices, risk factor items that are out of control, that can increase the likelihood of contamination and increase the risk as well. If it is a raw food that happens to be a TCS, there may still be high levels of competing microorganisms. So quality is probably going to suffer sooner, but you might have a little bit more margin there as well. So just keep in mind the pathogens that you're talking about, and you might have to be a little bit nuanced in your response. That can be useful in certain situations, particularly if there's a large quantity of food. I want to call out this table taken from Annex 3 of the FDA Food Code, and it shows estimated growth of several pathogens under ideal conditions. And this is the basis for that 6-hour time as a public health control allowance when the food is taken from 41 or less and then held in an ambient of 70 or less. So it gives you an idea of some of the margin that's built in. We talk about the log growth after a period of hours for different pathogens. So if the pathogen happens to be present, then you've got some margin built in there.
We did have a question that came in about the product assessment, which is the section that I had talked about. So just real quick, a lot of times in relation to that being a requirement for a variance, and it really kind of depends on what that process authority maybe has done to look at that, and with the formulation and how that's going to be done, if there's some critical steps within that process. In a lot of cases, that is usually the direction, at least in Colorado, that we would lean toward, that if you want to move it out of that and identify it as a non-TCS item in how it's going to be held or how it's going to be interacted with, then we would go down that variance path. So that's a great question. Thanks for dropping that in the chat, in the Q&A, I mean.
Yeah, and it's good. It's going to be a program decision. Transparency and accountability and being able to refer that in the future is going to probably dictate how your jurisdiction determines how best to handle that. And maybe if it's food A held in a very specific way, then it's non-TCS. That would lean me more towards a variance versus something that's like this. We're just categorizing this food that nobody really understood initially to be as the TCS. So yeah, jurisdiction by jurisdiction, the key point would be that you make a transparent decision and keep it for the future so you can remember what decision you made. It's a great point. All right. I think we've got the background set up. We've reviewed the playbook, and now it's game time. So we're going to look at several products, and we're going to see what you guys think. Just like you walking through, maybe doing your initial walkthrough during your risk-based inspection, you're going to evaluate the food, have about 10 seconds to vote. All options are going to be presented in the same order. So you pick, is this particular item going to be definitely a TCS? Probably a TCS, probably not a TCS, definitely not a TCS, or do you need more information? And I have a hunch a lot of people are going to say, I'm going to need more information. We're going to discuss some of that additional information that you might want, but we'll see what y'all think, and you make the call, and then we'll see what Troy and I think. All right, first poll should be up. White bread. Started off with maybe seems like an easy one.
Yeah, typically I would think that, what's the question here? We'll be interested to see what the response is going to be.
All right, so we had 76% said definitely not, and another 17% said probably not. So that's a really strong number that's leaning that way. I'll tell you, this one's an interesting one, and its crust is definitely not. The water activity is going to be very low there. The white bread part, the center of that bread, is probably going to have a pretty conducive pH, 5 to 6.5. Sourdoughs are usually a little bit lower. The water activity is going to be above 0.93. This is one of those ones that's kind of an outlier. Technically speaking, you could make an argument that it is a TCS food, but we have a long history of safe use. So even though it meets the definition, I'm not aware of any jurisdiction that is requiring it to be either held at temperature control or do a product assessment. So don't probably need to worry about that one, but it's one where might be a fun add to the definition someday. Next.
Definitely, because I think if you had that water activity, and again, that correlation between pH and water activity, just went through that and understand the crust, how that water activity interacts with the rest of the product. How about this one? Looking at this next item, what's everybody's thoughts on this?
Focaccia, we'll just kind of keep it as the picture right there. We've got some different herbs and spices. We've got some tomatoes. Looks like they're cut. And looks like they're going to be heat treated.
Well, the ones on the right may not be heat treated, but they are cut. So, taking that into consideration, right?
Yeah. So, and then the last one, is it baked? How is it baked? Those are some interesting questions, but ultimately it comes down to those intrinsic factors of the bread. So we can worry about some other things on that one. Oh, a little bit more of a spread here.
Wow.
Just over half, got a majority here saying it's TCS, either probably or definitely. Quite a few right in the middle, and then a lot need more information.
I think we missed out. We should have coordinated this with a FanDuel or something like that. With these odds on this one could have been, we could have made some jack on that one, wouldn't you think?
If you have a gambling problem, call 1-800-BETS-OFF. But yeah, that one could have had some interesting action, I'm sure. So what do you think on this one, Troy?
Yeah, we definitely have a much different situation with the moisture on this. We've got a lot more moisture that's going to be added. We do, because of the baking, have that heat treated plant food that's going to be taken into consideration. So there's just a lot more nuances that are going on with this. And typically, I think I'd lean towards the, let's treat it as a TCS until maybe it's been proven to us otherwise. If there's going to be, some research that they might want to provide to us at this particular facility. What's your thoughts? That agree?
I definitely agree. It's going to be these kind of mixed products like this. You're going to have that interaction with the interface. So you have to have each component evaluated, and you're going to have that interface evaluated. So it's pretty intensive product assessment from my experience. So it would lean to that.
Yep.
Yep, I would lean to that being a TCS, and it's probably going to be a lower risk depending on what it was. Maybe this is a sausage focaccia or cheese that might increase it. With this one, we could probably work with them. We probably got a matter of hours or days. We're not instantly worried about this one being unsafe, but I think it's going to fall into that TCS. All right, jump over to another one that we commonly see. Got some barbecue sauce. This one's made in-house. Oh, a lot of people want more information.
Ooh, I like that.
Yeah.
I do like that.
Depends on what's in it. That's the first comment. Depends on what's in it. Yeah, that's a good one.
Depends on what's in it. You bet. That's a lot of, I mean, a lot of questions need to be asked. We just can't go in there as an inspector and go, oh, okay, it's this. Look at that ingredient list. And if everything on there has a pH very, very low, fairly acidic, and there isn't anything that's a middle pH that might differentiate from that, we're probably going to be able to go with that's non-TCS. But just looking at it from a glance, I can't go there immediately. It's all something that needed to be taken into consideration for sure. Is it vinegar based? Is it ketchup? Are we adding a sauce like a mango or something that may not be a low acid type of product? All things to consider. I like that we have no more information on that, right, Adam?
Yep, you might be able to screen that if you got a pH test strip and it comes back below, a lot of those have a 3.8, and if you're at that range, which is probably pretty common with most of these barbecue sauces, you're probably going to be fine. You'll have a lot more time. You can work through the details and the record keeping with that. But yeah, that mango, that low acid component that's significant is going to change that chemistry. So look at that formulation. Summarize that very well there, what's in it. Salsa, fresh, made on site. You get a good sense of what we're talking about here. With that picture, kind of a pico. Looks yummy. Good thing I already had lunch today, or I'd be really hungry. Need some chips, yeah. Mario says we need some chips. Some bare hand chips come with that salsa. All right, got a lot of people saying definitely a TCS food. That's a real strong answer there from folks. They're pretty definitive there. What do you think?
Yeah, it may be something that, depending on how fresh it's going to be, do they need to, TCS, but are we going to be able to apply maybe a time temperature control in relation to that we could be able to keep it below that 70 degrees and maintain it for 6 hours when it's made, to take that into consideration. So still under that TCS realm, but would be an area that you'd be able to kind of take a look at and assess accordingly on how it's going to be stored, how it's going to be processed. Is there a lot of acid maybe added to it? Is it formulated? And could this be one of those product assessment pieces that they want to keep it beyond maybe a time and temperature control element that could come into play?
Yeah, tomato is going to have some pretty good variability. Cut tomato, we've seen that as starts from the definition as being TCS. So you could work your way out of TCS. It's going to take quite a bit of work. I think TCS is a good place to land with this one. So sometimes we see a different variation on the salsa theme. So let's talk about a cooked one, also made on site. Folks are still pretty strongly in the definitely probably TCS here. Do have some folks more in the need more info camp for this one. Comment there, pH level is key. I think that's definitely something you could take a look at. If we're coming out of a canned tomato product, it's going to be formulated, it's going to be acidified and properly processed. That's one thing versus maybe they are doing it traditional and cutting up their own tomatoes. And that might be a little bit different answer. But again, once it's unpackaged and we've heat treated it, we can confirm the acidity because maybe it is low enough pH that it's not going to be TCS. We could document that, but we'd start in that TCS camp from my standpoint.
Yeah, most definitely. It's that goes back to that question. Where's our attendees that are from Missouri, the show me state? Show me how you made this cooked salsa, and that may help you, peel that back and figure out what exactly they've got going on with this.
Very good. All right, folks are on their A game today. Now let's jump over a little bit different one here. boba, got the tapioca pearls.
Yeah, we don't have our second and third string Chiefs playing today. That's for sure.
We sure don't.
38-0. Had to drop that out there.
Who are we trying to keep out of the playoffs again?
Yeah, okay.
Conspiracy
All right.
theory. Yeah, and while folks are voting there, herbs are outside that definition of cut leafy greens in the specific codified language. So you would not have to count those until they're heat treated. And spices have been implicated, and that's a great to that point of they may be contaminated, but time temperature control for safety is not going to change that. It's not going to reduce that risk particularly. So it doesn't, just because you're contaminated doesn't kick you into that TCS category.
Wow. Could we get more of a cross section on this one?
Very even this distribution here.
Definitely. Wow.
Yep. So let's see. My math is not mathing great, but I think we're just over majority at TCS camp. And then the rest of the way down want some more information. What are you thinking?
Yeah, I think when we look at this product, it's going to be heat treated plant food. As far as that tapioca goes, and there may be throw a bone to the 21% that's the need more information. Looking at that product, looking at that label, maybe if it's got a very, very high sugar content, that's going to have an impact on the water activity. So there's maybe a little bit more in needs information, but probably lean towards that TCS realm on this one, time temperature control for safety.
Definitely, we're probably going to see that 4.7 to 5.3 with the high water activity. There are some that are high sugar varieties, then that could alter it. But I think the default here is going to be TCS.
Yeah, common in their low risk TCS more than likely. That's for sure.
It could be. It could be. Again, the formulation is going to be important on that. Now it is dessert time. Let's talk about banana cream pie here. Whoops, easy. There I go, jumping ahead. The electrons are flying. So we're still talking about banana cream pie, and most people answered on the TCS camp there. What questions do you have about this when you're making your determination, Troy?
Where'd it come from? Who made this thing? What are we dealing with? Maybe I need more information. Sugar content, like I mentioned about the previous one on the boba, the tapioca pearls. There's a lot of different elements on this. Is it a manufactured food product? What are we exactly are we dealing with? All elements that need to be taken into consideration.
Yeah.
Some comments in the chat too. Dairy, non-dairy. Definitely some elements. Looking at that formulation again. Yep.
Yep. And of course, it's all predicated on how are they wanting to handle it. Are they wanting to set it out on the counter all day? Is it a date marking question that we're having? So that's all going to come into play as well. How do they want to handle it? That's one of the questions on the job aid is, are they wanting to store it at room temperature? Because that could be make a distinction. If they just want to treat it as refrigerated or time as public health control, you don't even have to worry about it. That's fine. We can deal with that as well.
Yeah, quite a few of these, you run down through that job aid, it's really going to help you get you pointed in the right direction.
All right, just past the holiday pumpkin pie season, what I consider to be peak pumpkin pie time of year. So let's see if folks can remember the last couple of months. Oh, another good spread. This should be fun. I think much like the last one, we're going to ask, is it formulated? Did they make it? Yeah, Eric's got it in the chat there. Store-bought. Randy, is it in-house? Brian, did they make it, or is it formulated from food manufacturer? And then it's going to have probably a lot higher chance that they've actually taken that into account if they want it to be able to be displayed or held at room temperature. Made in-house, unlikely that they're going to have that. We're going to have the pH and water activity in that nice range to support growth. We've had heat shock, so any spores that might be present are going to have a chance to grow out. Any competitive microorganisms that may have been there are going to be destroyed. Now, they could be starting from a canned pumpkin pie filling as well. That's probably pretty likely, so that can change the profile as well. But as was a comment earlier too, this is probably going to be one of those ones that you default towards TCS if they want to handle it in some other way and let them prove it otherwise.
That's usually a really good default for safety, is to go that direction. Somebody mentioned about Costco keeps theirs in the coolers. Is that from a food safety standpoint or from a quality standpoint? Things to be taken into consideration. It's good to see that they do that just to cover that base as well. More than likely, it's going to be a manufactured product, and it would technically be shelf stable. But yeah, always a good default for sure.
And remember, trying to keep food safety in mind first. Getting it into this category of TCS, again, it depends on what they're trying to do. You might have some flexibility to work with them. It's not necessarily an instantaneous violation or discard. So situation by situation, you got to read that play and respond appropriately. Cream cheese frosting. Now this one's hitting my sweet tooth. Probably with cottage foods exploding across the country, this is probably comes up in a lot of different areas as a question mark. But it doesn't change the fact of whether you could make the technical argument as a TCS food or not. And another pretty good spread here, leaning towards TCS, but a couple that want more information. I'm guessing the information they want is probably related to sugar content. What do you think, Troy?
Sugar content, and then what do we got as the base? Are we using a butter product? Are we using butter for that to begin with, or are we looking at a ghee that may actually have a lower water activity than what our butter has? So definitely taking all that into consideration.
Yep, it's a standardized recipe. How closely are they following it? 65% sugar by weight is going to give us a pretty good sense that this is not going to be TCS. It's going to have enough moisture bound up that the water activity is going to be that low. I'll tell you, there's a link we can put in chat, a resource that friends at K-State did. And this has a variety of things. It's intended for fair display, fair judging, but the science is sound behind it. And it says if you have this formulation of some of these, quite a variety of recipes for these frostings and fillings, whether you're going to end up in a TCS realm or not. So that could be a resource. There's a great resource, the Texas Cookbook for their cottage foods, another resource that you can have. So this is a good one. There's enough to worry about in life. Hopefully we can get our cream cheese or buttercream frostings to be safe. Okay, raw meat and poultry. A little bit different angle here, kind of a cut back, reversing field on a dime, breaking ankles on this one, going from cream cheese frosting, buttercream frosting to raw meat and poultry.
Just in the past, running down the field and lateraling backwards.
The flea flicker, I don't know, this was a crazy one. All right, definitely TCS. Definitely TCS. I don't think there's any question about that. It's right there in the definition, raw or heat treated animal food. So we've got that. So what do we do with that information? That's, I think, the question for me in this particular example.
What needs to be taken care of here? Because we admit that that's the case. I mean, it's right there in the definition. It talks about the raw. The key part of this is going to be what's going to happen with it.
Yep. So we've got a lot more margin built in here. Listeria can compete. It's also pretty heat resistant, but if it's intended to be cooked, that's going to be a lot lower risk. Fully cook it appropriately versus something that's going for consumer advice, where you might give you a little more pause. That's already risky to start with. So this plant, sorry, the guy saw the chat there, popped it on my head. We've got a lot more room to work with on that raw meat and poultry because of that high level of competing microorganisms. So you can, if you're prioritizing some things and you got to make some decisions, you maybe be able to put this one lower on the list. And Meg loves eating raw meat. So that's an interesting comment for sure. There was some question in the chat about plant foods. And so let's talk about nut milks for a second. Let's see what folks are thinking on this one. This is kind of an up and comer. We've got a lot of different food items coming around. People trying to do different things, getting creative. This is one of the ones we see from time to time now. Another pretty good spread here. Just over half think it's a TCS. We're pretty sure it's TCS. What's your analysis?
No, I do like that we've got some of those need more information, because it kind of really does come down again as this ongoing theme that we've been having here is the formulation. How is that made? If it's a heat treated product in the process, then yeah, I definitely would lean towards that TCS piece. But again, it's how that product is being made. I would say that, let's go with the TCS until we find out something different.
Yep. Good pH, good water activity. Now, an interesting one here is, was it a raw nut milk or was it pasteurized? So if it came in from the commercial process, it's pasteurized. Otherwise, it's not heat treated. There's that potential. So you might have a little technical wrinkle there, and it may or may not fall into that category if it's made in-house. So yeah, and then shelf stable until it's opened. But again, that's because it's in its protective cocoon and it's been handled in a way that it's not going to have pathogens in that package. So another good point. So another good, just great example of all the things you're going to have to consider for some of these. If you're encountering an issue with it being held out of temperature control or not being date marked, etc. Start with that job aid and work through the process. Similarly, now nut cheese. So these are these kind of cheese analogs where we take different source of protein and oils and carbohydrates a little bit, and we mix them together in a special way. And in this case, we're kind of showing a pistachio cheese. We've seen some other types of walnut cheeses. This cashew cheese is a pretty big one. A lot of people need more info, and then the rest is leaning towards TCS on this one.
Yeah, it's a pretty big overall percentage, and I like to see that. I think we can pretty much, again, depending on the formulation, it was heat treated during the process, a ferment steps, likely going to be TCS just by the way the product is going to be typically made. Yep.
Yeah, there's that classic bucket bowl years ago of a fermented cashew cheese that was just probiotics thrown into the mix and then put into an anaerobic environment and created nice salmonella soup. And so gonna fall into that category of TCS most likely. Again, with that one caveat, if it's somehow not heat treated, then it might not be technically, but still want to look at the risk on that one. I'm liking these results. Okay, bacon. Everybody, well, not everybody. A lot of people like bacon. Bacon's maybe popularity not at its peak anymore, but still pretty popular. This is cooked bacon. Gwen's right on that, her thinking. We'll probably mention that here in a second after we
Yep,
get the
I
results.
saw that drop in the chat.
And understand that in Arkansas, bacon is still at peak popularity. All right, so we're leaning heavily towards not TCS on this one, with a few folks needing a little bit more information. I remember this as an inspector, we had that thing that said if it's crispy bacon, it's not, back then PHF, it's not TCS. And I said, wait, is there what's the ASTM test for crispiness? Do we have what's the scientific benchmark? I want to know. So we got the crispy versus uncrispy. Either way, it's going to be a pretty low risk item. It's probably going to have the low enough water activity. But, you know, again, if in doubt, if you have some question about it, if it's raw, you've got some more margin there built in. But this is a fun one for discussion. Any other thoughts on this one, Troy? Everybody loves to talk about bacon.
No, I think you hit that pretty good. And I think the key to take home with this one is either way, if it, how crispy is crispy. We're really looking at a low risk product overall, when we're dealing with this. So, where we've got for this spread, I think we're in a good place, really do.
Side note from the chat, on the nitrites and nitrates, this bacon's actually limited to a little bit lower level than some other processed meats, because that high heat that you typically see when you're cooking bacon can do that nitrosamine formation. So slightly less than certain other processed cured meats. Not related to TCS particularly, but just a curiosity for me. All right, we're moving along. I know we've got a few slides. I see the clock is ticking down, coming down to the wire.
Are we at the 2-minute warning?
I don't know. The snow is obscuring the game clock. My view of the game clock is obscured. I'm flying blind.
Wonder what everybody's going to think about this one.
The official weighed in there. We got 5 minutes, so it's coming down to the 2-minute warning.
I think we've used up all of our timeouts, so we definitely need to game plan here pretty good toward the end.
So we can probably run the hurry up offense on some of these slides, because there maybe be a little less considerate, but just some fun ones still. Definitely TCS, probably this one looks like it is. So
wow, that's a pretty good spread there. Yep, look at that.
Yep, it is a TCS. So the question for me here, I'm going to fall in that TCS category. Most likely, there could be some eggs, there's some flour, there's moisture. The flour gets some heat treatment. You can argue about that when it's being milled. But what's going to happen to it? Is it really a concern? So is there some extreme temperature abuse for it? It's likely going into a fryer. It's probably pretty low risk. And Crystal, if chicken's been dipped into it, I disagree a little bit. We got to look at the characteristics of it. It's clearly contaminated, or considered contaminated with salmonella and campy, if nothing else. But is it TCS? Does it support growth? Is time temperature control necessary for safety there? Yeah, probably is, but it's going into the fryer, so it's going to be lower on our risk spectrum. We can put that lower on our bucket list, on our checklist and punch list.
A little bit of a rabbit hole here. What would you feel about, Adam, on like a dry, like more of a flour-based, not a liquid that we're going to be dredging this through? What would be your thoughts on something like that?
Yeah, same. That one from a TCS standpoint is probably a secondary question. It's probably not, because the moisture is probably going to be a lot lower, but it's going in the fryer anyway. It's going to be fried, so I would not worry about that one too much. I'd focus my energies on some other things.
Yeah, I see a couple of shout outs in the chat about sifting and getting that moisture out of there, that moisture part. Moving on to that next one. How about that waffle batter?
I'm sure many of us see this at the hotels, particularly. The packs just don't stay cold in the. I love the waffle machines. I mean, it's one of the things I look forward to when I do have to go on the road. See what other folks are seeing there. Need more info. I think that's fair. Similar discussions before. It's basically almost identical to what we were seeing in that batter question. It's just going into a waffle now, and it's not going to be exposed to chicken, which is irrelevant to the TCS question, really. But what's it going to? It's going to be cooked on that waffle iron. Some of the waffle irons can run over. You know, there could be some, but I just have not too much concern, even though I would say it's likely a TCS. I would say it's a lower risk TCS. What do you think?
Yeah, I'd lean that direction as well. I think there'd be other concerns that I'd be wanting to focus on and not have an operator get wrapped around their waffle batter with this particular element. We need to make sure we've got other pieces that are being addressed before we're going to really go down this path.
Yeah. Hopefully we can get them to keep it cold or use time as public health control just to kind of check the boxes and make sure, but we'll probably be all right. Hash browns reconstituted. So we see this a lot. They'll do the hot water in the carton oftentimes, and then we'll follow the directions there. There's 10 seconds. I can't take it, Troy. It's a nail biter. Are we gonna hit the mark? Yes. There they go. We see it. Okay. Leaning towards TCS, but there's a pretty strong contingent on the other side there. What do you think?
Yeah, how long is it going to be out? A lot of elements need to be taken into consideration. We're talking, yes, probably heat treated, but we're going to crisp that up pretty good. Is there going to be a big deal, a great deal of risk associated with this? Another thing to take into consideration for sure.
Yeah, keep it on the list, but can probably focus energies on other things first and work back towards that one. I got this. It's like Risky or Not. That's another podcast. Concerned or Not. That might be a good title for what we're talking about here. Butter. Let's just run through these. I think we're going to run out of time with the polling, but butter. I think the technical answer is yes, but we'd put that on the lower spectrum. Salted butter is going to be probably the only thing we have to worry about is Staph aureus with butter. So no bare hand contact, we have less risk. And if it's salted, we have even less risk. But technically considered a TCS food. Cheddar cheese. It's going to be in that TCS range currently. There's been some movement to try to get this kind of cheese taken out. However, it is a low moisture. Still subject to date marking. It's an exemption from date marking, which means we're going to default to TCS food, probably a lower risk TCS food. There is an interesting link there, some cheese science, if you wanted to go down that rabbit hole. Daphne, appreciate you putting that into the chat. American cheese. It's not exempted from date marking, and it is a TCS food. So probably seen a lot of these come through from some of the fast food chains where they wanted to hold these for extended periods of time, and that's where we kind of get back into that. Probably going to have a variance for that, or some other plan if they're wanting to hold it beyond even 6 hours at 70 or less. So yeah, and I haven't kept up with the certain major nacho cheese type food product that the legal name keeps changing because there's some standard of identity issues. Brie. going to be that same kind of question, but even more moisture. So we are going to have TCS categorization for that. And if you wanted to, there's cheese science on the effect of pH on cheese melting. So if you really want to get deep on that, maybe check out the cheese twins as well. You can learn a lot about that. Anything else here at the last few seconds, Troy? I think this is probably a good one to end on. Garlic and oil, just in the definition, literally. So it's TCS, it's high risk, going to have a botulism concern there. And want to make sure we're handling that one appropriately. If it's not the formulated kind that's acidified, et cetera. Now, that one caveat with that, of course, is if it's a powder, no moisture available, then we don't have to worry about that. But there's resources out there. They're in the chat. pH, water activity is a good starting point to help you work through that job aid from FDA. And that's the ball game. What a barn burner.
Yeah, and the big thing, I think, look at that formulation, ask those questions. We can't make assumptions on a lot of these, and we saw that through all of the examples that we gave through most of this. Sorry, Brenda, go ahead.
That it?
Well, just say, have a game plan. Like Troy said, read that playbook. We want to focus on those higher risk things. We want to keep our energies focused on the higher risk and work our way down from that point. So we have the most bang for the buck. So great game. Appreciate everybody's interaction. Great chat. Troy, thanks for being here in the booth with me, and we'll see you next time.
You guys were awesome, and you get lots of thank yous in the chat. Great information, great examples, walking through it with such detail and information and provoking thoughts from everyone. So thank you for both speaking here and bringing your expertise to the table. And there's lots of questions in the Q&A that they will be answering as we go. There's also some questions from the chat that they'll be answering. And we're going to take a 5-minute break. So please mark your timers and be back in 5 minutes. Okay. Thank you, guys. Okay, if everybody will make their way back, we are getting ready for our next presentation. And if in the chat box, you will see that Daphne again has put in the link for a participant guide, which you can use and follow along with for this session. And this last session is called the Mindset Quest to Personal Success. I know all three of these speakers, and I can tell you that they are fabulous in this arena, and I'm very pleased to be able to introduce them to you. So the first person is our very own Jennifer Hardy-Tyndall. She's the Director of Training for AFDO. Her learning and development career has spanned almost 30 years, including work for a Fortune 500 insurance company and working in the food safety industry. Her vast experience includes instructional design, coaching, performance consultant, project management, facilitating, presenting, and anything else that needs to be created or accomplished to achieve a stellar project objective results. She's fabulous. And then there's Summer Williams. And Summer is currently the Food Safety Division Deputy Director at the Georgia Department of Agriculture. She leads the Georgia Food Safety Food Defense Task Force along with overseeing the Georgia Rapid Response Team and Recall Program. Prior to her work with the state of Georgia, she worked with the Florida Department of Agriculture and Consumer Services and Food Safety and in law enforcement for over 13 years. Way to go, Summer. And then last, but certainly not least, is Chris Peasley. He is a 30-year veteran of the retail food industry. How about that? His retail experience encompasses time as a retail manager for the world's largest retailer. Think about that. And a small regional organic cooperative and the United States. And prior to this retail career, he spent 6 years in the food service industry as a sous chef. That's why he's a foodie too. In 2018, Chris was hired by the Georgia Department of Agriculture's Food Safety Division as their retail food program manager, which is still the role he has today. So thank you all three for joining us today, and I'm going to turn it over to Jennifer Hardy-Tyndall.
Thank you, Brenda. Hey, everybody. We're so excited to be back. This is like our third year. And I want to see in the chat here, give me a 1, 2, or 3, since we've been doing this presentation for 3 years. And give me a 1 if this is your first time. Shoot a 2 in there if you're second. Give me a 3 if this is your third time. Oh my gosh, lots of 1s, lots of 2. Oh, 3. I saw a 3. Y'all are on fire. Because I was gonna say last year too, y'all were on fire. I see a few 3s, don't you, Chris and Summer too? And there lots of 1s, lots of 2s. Super excited to be here with all of you today. And we are here to kind of take you through the rest of the day. And again, in the chat, give me a let's go, type in let's go for who's ready to embark on the mindset quest to personal success this afternoon. Give me a let's go in there. Love it, love it. All right. So we are here to take you on a quest this afternoon. So I'm hoping that y'all put on your comfy clothes, your boots, you know, stretchy pants. You've got your water. I've got my hydration. Hopefully you've got your sunscreen, all that great stuff. Love the let's go. Love the energy. Excellent. We are going to be taking you through today. We're going to get you prepared with some tips and hints and tricks and things like that to get you started in 2025 with our mindset to personal success, basically. So we're going to be taking you on a quest today. Now, just like it says on the screen here, like food nourishes our bodies, right? I'm a foodie. I think we're probably all pretty foodies. We all love our food, but information and continued learning also nourishes our minds. So that's why we're focusing on our mindset today. Now, as we go through this quest this afternoon, I have to let you know that I want you to keep your eyes open, because what happens on a quest? Well, quests are full of like perils and pools and I don't know, ditches and all kinds of things, right? But do not fear, because it's not just me. We also have Chris and Summer that are going to be joining us today as your guides during this mindset quest for personal success. But we're also asking that and I can tell you have lots of energy. We really want all of you to engage. We're going to be asking you lots of questions because we're all in this together in this quest, and no one will be left behind. We will succeed in our quest for today. So also with your mindset quest, one thing I'd like you to keep in mind is that I don't want you to just think of your mindset in the work environment, all right? I want you to think of your overall mindset when we're going through these activities. Because, you know, we're more than just work, we're our whole entire life, and our mindset, it goes with us everywhere and it affects us everywhere. So first off, as we go through our quest here to get us kind of ready, I'd like you to pull out your guide, and I see that it got put into our chat there a little bit ago. You can either print it off or we made it so you can fill it out just online, you know, so you could put it on your screen there, and there's some fillable areas. But go ahead and turn to page 1, and let's do some quest prep. There's 8 questions here. What I would like you to do is go ahead and mark if you mostly agree or if you disagree with each of these 8 statements. We are not going to ask you, you know, what you put down. This is for your eyes only. So I want you to, you know, just be very honest. Do you mostly agree or do you disagree? You can click, you can circle it, all that good stuff. So I'm going to give you about 20 more seconds. Start giving me some thumbs up if you can, or a done. Either a thumbs up or a done when you're finished in chat. So that'll give me a little bit of idea on how we're doing. But page 1, mostly agree, disagree. Don't overthink it. You can always change your answer later. We're pretty easy going, aren't we, Chris and Summer? It looks like we've got some dones. Ooh, I like the money bags and stuff. Nice. Thumbs up. I always love the chat because I can't see all of you, so it makes me feel less lonely, like I'm not just talking to myself. So, and there's a little chick. Love it, Eric. Very fun. All right, I'm gonna give you 10 seconds. We're gonna count down. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Let's move on. Now, again, I said, let's grab our hydration. I even have my backpack. You know, I'm ready to go, y'all. I've got my backpack. I got my hydration. I'm telling you, I came super prepared for this. I also have a secret item here to my right that we'll use later. So grab all your things. First off, we need to figure out where we're going to go first. Of course, when we're on a quest, it's like, which direction are we going to go in, Jennifer? So let's roll our dice here. And our first stop is going to be the land of lifelong learning. Let's take a look at what this looks like. Oh my gosh. So beautiful. I'm here in Michigan, so we have a lot of snow and everything. So this looks quite delightful to me. It looks pretty good, doesn't it? It's sunny, it's beautiful, there's water, looks very happy and relaxing. But I have a question on there. So what is lifelong learning? Let's blow up that chat there. And I like the woo-wee and the majestic and serene by everybody there too. But what is lifelong learning? We throw this term out there all the time. We're like, you should be a lifelong learner. Are you a lifelong learner? Curiosity. Okay, great. Yeah, open-mindedness. I love that. Maintaining curiosity. Nice. Always learning new things. Willing. Never too old. Yeah, I've been trying to tell myself that. I'm like, okay, Jennifer, you just turned 53. You're not too old, right? Even though sometimes I do feel kind of old.
You're a spring chicken.
Oh, you're very kind, Chris. Thank you. Ooh, exercising the brain, growth. Yup. Actively seeking. Oh my gosh, you're nailing it, right? It's all these things, right? So my son, he just turned 19, and we had this conversation the other day. I'm like, Jack, honey, when you're, even when you're done with college, like it's so important, because he's just a freshman, but when he's done, I'm like, it's important to always be curious, right? I like that, ever forward. Oh my gosh. Gwen had said, I knew a guy who started medical school at 47. You're never told. Absolutely, right? It's that we're never to the point where we think we know everything, right? We're always embracing this lifelong learning. So it's a good thing, right? This is going to help us on our quest if we embrace this. Let me throw another question out here for you, okay? Why now? Because so we talked about what is lifelong learning. So why is lifelong learning a critical element of personal success? Why? Ooh, elastic brain. Ooh, okay. It provides focus, gives you something to strive for. Love it, love it. Life is boring without it. Ooh, I like that too, right? Because I mean, if we're just like slumped back and we're just like, I'm done, it's boring, right? My gosh, what else? Chris, are you my backup on this too, or Summer? I'm like,
I
and don't
am. There's a couple
forget,
comments in there that really hit home. One said, because things and people change, and if you continue to do the same thing, you're going to get the same results and be behind the times.
absolutely. I mean, these are so good. Y'all are amazing. I love this. Right. Right. The world is ever changing. Can you even believe it? How fast everything changes? It's crazy. It's crazy. So if we're not in that, always being curious. I love that curious, being curious and looking to, expand our brains. Yeah. When you think you know everything, you end up knowing very little. Very true. I mean, isn't that so the truth? It's like, oh, I thought I knew, but I really didn't know, right? So I'm going to ask you all a question here. 32, and if you've been here before, you probably know the answer. So hold back. Let some of our first timers see if they can get it. But 32 years ago, something really huge happened, and I'm going to give you a little intro for it. So this was said by NPR's Neil Conan. They said, imagine being able to communicate at will with 10 million people all over the world. This was in 1993, okay, kind of going back, as my son will say, in the 1900s. I'm like, oh, geez, buddy. And he said, imagine having direct access to catalogs of hundreds of libraries, as well as the most up-to-date news, business, and weather reports. Imagine being able to get medical advice or gardening advice immediately from any number of experts. This is not a dream, he continued. It's yes. And I saw it out of the corner of my eye.
It's all over there. They are all over this like a hobo on a hot pocket.
I know you guys are awesome, and I want to show you this because I found it kind of interesting, right? So 1993, I was in college, still typing on one of those typewriters, and I thought I was awesome because you could actually like go back and erase things. I thought, woo, this is the best, right? And then all of a sudden, there's this World Wide Web. It's this internet thing, and it's like, what is this? So if we talk about life learning, I bet you that some people, when the World Wide Web, when NPR's Neil Conan said this, some people are probably like, what in the world? Like, no way, this is weird. Nobody's gonna like that. This is not going anywhere, right? And as you can see on this graph that I just put up on the screen here, that even within those first 7 years, just 52%, I mean, which is pretty good, right? In the year 2000, that 52% of people were using the internet. And they were like, this sounds pretty good. But look at all the way up until 2021, it took us to get to 93%. And it's kind of interesting to me when I look at this, that there were some stagnant areas. So there probably were still some people that were like, no, thank you. I'm not doing this. No, this won't last. They maybe didn't have that lifelong learning. And my gosh, now, can you even imagine life without the internet? I mean, it's just crazy. So now I'm going to ask you another question. Hit me up in the chat. What is the big thing now that people are like, hey, this is the next big thing? What is it? AI. Absolutely. Yes, AI. And it was so interesting because last year it was kind of right. We were just kind of talking about it, and now it's everywhere. AI is. So I ask you, are you embracing that lifelong learning of AI? Because that is the new big thing. And chat GBT and all that good stuff. I will say that that's why I love being asked to come back and do this session, because it makes me rethink. Hey, Jennifer, did you stick with that? Were you a lifelong learner? Did you do what you said you were going to do last year with chat GBT? And I will say I've gotten more on board with it, and I tried to incorporate it into my thought processes of research and things like that. Is it hard? Yeah, it is change. It's something different, but it feels so cool, to be that lifelong learner. So lifelong learning is definitely amazing. I saw you get excited. Yes, it's a great place to be in it. But also in the beginning, I mentioned that what could come up along the way during our quest. Perils, right? Of course, because that's how life is. We love it to be a straight line, but some perils come in along the way. So Summer's going to help us out with that.
All right. Thank you, Jennifer. So, oh man, look at that. Look at that screen there. As a Florida girl, I'm gonna say that those obstacles there, those mountains, are a little doom and gloom for me, a little threatening, to be honest. But like, wouldn't it be nice if things could always go smoothly? But honestly, obstacles and those perils are always a part of life, unfortunately. They can stop us and they can slow us down, but they can also help us grow and learn. So, for the group, what obstacles can get in our way to lifelong learning? You guys can throw some answers in the chat box. I'm sure each of you guys have experienced obstacles that have gotten in your way, distractions.
The chat box is going so fast, you
Yeah.
can't even read it.
I know, I can't even keep up.
We got a pretty engaged crowd here for our adventure today.
Right?
You think people have had obstacles? Just saying. I think yes, right?
I'm seeing a lot of health and illness. I know it seems like a lot of people got the crud going on here with the new year, seeing that on there. Getting old, okay, seems to be a theme today. Money issues, finances.
Fear in there too, so interesting, that fear. And that's what we're talking about today, is that mindset, right? Like that fear can block us, and that can definitely be an obstacle.
I saw a comment in there that said that hill, that mountain, or that obstacle looks like a nice hike. So somebody's got the right mind frame. Take that obstacle and find a positive way to overcome it.
That's true. All right, these are great. These are really helpful. So, things like these can get in our way of this lifelong learning. And they're also very similar to the swamp of toxic attitudes that can fall in along of our mindset quest to personal success. So I'm going to pass it over to Chris.
Well, welcome, my fellow lifelong learners and adventure buddies. Let's go and cover some obstacles today, what we refer to as the swamp of toxic attitudes. So some of the things that we'll find in the swamp of toxic attitudes are being negative, and negativity isn't always attributed to negative people. Even the most positive people can be pulled into the swamp. Sometimes your passion, personal, professional life can pull you into the swamp. Disgruntled coworkers can pull you in, and life in general can drag you down by both feet in a New York minute if you're not careful. Be mindful. Watch your step. Waiting idly by, waiting for things to come to you. Nothing will be given to you that's worth having. So grab a golden monkey idol with both hands and make your own destiny. Shameless Raiders of the Lost Ark plug, totally intended. Take your shot. You'll miss 100% of the shots you don't take. There's a great debate on who actually came up with this sports analogy, whether it was Michael Jordan or Wayne Gretzky, but I think we can all agree that both of these guys know a thing or two about taking the shot and winning. Another one of our obstacles is not believing in your own success. If you think you can or you think you can't, either way, you're right. What can you do? Well, believe in yourself first and foremost. In those times you don't, or your confidence is shaken, align yourself with someone who believes in you more than you do. Those who can motivate you to take a chance, go for what you want. If all else fails, they can assist you on your quest. Another sports analogy, you'll get sick of them before the quest is over, but even a great shooting guard needs a point guard. And I'll tell the story. I told the story on the previous two ones. I had a confidence problem about 7-8 years ago when I was looking for a career change. I didn't think I could do anything other than retail. It's all I knew. I'd done it for 30 years. And my wife sent me a job listing for the Georgia Department of Agriculture, and I deleted it and put it in the deleted file. And every time that she asked me about it, I said, nope, I'm not qualified. I'm not going to apply for it. And lo and behold, January in 2007 or 2018, I got a phone call on a Thursday afternoon from Natalie Adan, and she offered me an interview. And I was like, I don't know what this is for. And I actually turned the interview down and thanked her and hung up and called my wife and said, did you apply for a job for me by chance? And she said, I sure did. How's it going? And I'm like, man, that was a mistake. So I called Natalie back right away. and scheduled an interview. And in the last 7.5 years have been some of the most rewarding in my career. And I was afraid to take that chance, but I had somebody that I'd aligned myself with in my corner who pushed me into something that may have been uncomfortable or helped drag me out of that swamp. Another one of the toxic attitudes is blaming other people. Engage your own thinking. Don't blame or dislike Bob for getting that promotion, the scholarship, the internship, the raise, etc. Maybe Bob has the right mindset for his quest to personal success. Maybe Bob has found a way to avoid the swamp of toxic attitudes. Take a look at the person in the mirror and take control of your personal success. Not asking for help. One of the most toxic attitudes that we fall into in a professional career. You can't do it all by yourself. You don't know all the answers. And the first step to overcoming that attitude is understanding that it is okay to say, I don't know, or I need help. We all have different skills, aptitudes, weaknesses. We're human. We all need help from time to time. Some mental strengths that would help you overcome these attitudes. Lean on include adaptability, endurance, steadfastness, dependability, and effectiveness. Some personal strengths you can rely on, being reliable, being flexible, being kind, something the world could definitely use a lot more of this day and age. Be hardworking, creative, punctual, and positive. Align yourself with folks who can provide these strengths for you, and when you need them the most, whether they're a spouse, a friend, a family member, a peer, or a mentor, these people are essential to help keeping you out of the swamp, or if you temporarily fall in, dragging you out by both feet. Anybody else have any other toxic attitudes that they might like to put in the chat box? Can I get a show of hands on who has been dragged into or fallen into the swamp of toxic attitudes?
Oh, heck yeah.
Guilty.
Everybody, right?
Yeah, I think we can.
Everybody. Just don't stay there, right?
Yeah, so the question is, just a great segue, Jennifer, is raise your hands if you would rather be in the land of lifelong learning versus the swamp of toxic attitudes.
Heck yeah. Oh yeah, we got a lot of hands raising. That's fantastic.
Good, good.
Ooh, I thought this one's interesting. Chris said, making your own conclusions rather than asking. Like, shoot, it went kind of fast there, but I saw that one come up, and that's true, right? When we jump to conclusions instead of asking for clarification, and that can put us into the swamp. Absolutely.
Yeah, absolutely. So the land of lifelong learning has a lot of helpful information on embracing lifelong learning and being on the lookout for obstacles in the swamp of attitudes during your mindset quest. So now it's time to gear up for our quest. So
we're going to roll the dice, and oh my gosh, we're going to do a gear checkup, Chris.
All right, so here are the 9 levels of things. So number 1 is develop an I love me file. To create a to-do learn list, various courses, care of your body, specific goals, morning 15 minutes, embrace change, fail forward attitude, growth mindset versus fixed mindset. So go ahead on your participation guide and make some notes down on some of those things that you want. One of the key elements of a successful quest is to look at the proper equipment and resources, and properly equip your backpack. I see Jennifer's the only one of us that has her backpack out ready. So she obviously,
everybody.
Yeah, she took this slide a little bit more seriously than we did. But anyway, now we're going to dive into each one of these individually and give you some insight on that. And for that, we're going to turn to tour guide Summer and let her walk us through some of these.
And Summer, I think
Summer, you're muted.
Yeah, that an obstacle was that something took away your voice during our quest.
Yeah.
There you go.
Okay. I don't know what happened there.
Told you we'd have
All
obstacles. It's those trolls, I'm telling you. That's why we're banding together, okay?
That's right. Well, thank you, Chris. I appreciate it. And, for those of you that know Chris and I a little bit more, you might know a little joke between us. He calls me the magical unicorn at the office since we work together, because he says I always have a positive attitude. So I'm always trying to fight, that toxic attitude. And this is something that's a little near and dear to my heart. So the first thing in your guide on page 5 is the I love me file. So this is something that you can start just collecting any positive feedback you've received, or maybe any success stories or anything that you have written down. You can keep it, this file, on your computer electronically, or you can print stuff out, or if you have some thank you notes, you can keep them, in an actual file folder at your desk, and revisit this. Maybe if you're having a bad day, kind of getting in that swamp attitude, say, hey, you know what, I'm going to review this and look at these and remember the good moments and how people were thanking me. And I will say, I actually have one of these. I'm a very visual person. And if I could show you guys my computer monitors right now, I like to print out little thank you notes and little affirmations and stuff. And I print them and I hang them above my monitors. So, if I take a little break and I look up, I'll see some of that stuff throughout the day, and it cheers me up if I'm down, or if I just need a moment, a break to look at something. It really helps me. And I've had plenty of little notes throughout the years in my career that I've saved, and it's really special. I know people might not want to be hoarders and keep those things, but it is really nice to look back on over your career. So does anyone here have an I love me file? Anyone in the chat box? Or you can give us a thumbs up. Or any ideas of stuff that you save for these files that maybe I didn't talk about? Awesome. Awesome. All right, I'm going to kick it back to Chris.
To combat the toxic attitude of waiting idly by, have a to-do list, or a to-learn list, something that you're interested in. A to-learn list can be written down or kept electronically, or even mentally in your head on just some things you wanted to do. I'll post something in the chat box after this slide that gives you some help on developing a to-learn list. What types of courses are available to put on your list? Could anybody list some things in the chat box that would be available to you, or resources to add to your to-learn list, whether it's online training, in-person training at conferences or events, things of that nature? AFTO training, one of my favorite places to train.
Oh,
in fact,
much kisses. Thank you, Rebecca.
I'm actually in Nashville, Tennessee at an AFTO training right now. So that's a great resource. Some other things besides formalized trainings where you require travel. We all understand we work for government agencies, state agencies. Sometimes travel restrictions can be pretty high and budgets are hard to, but there's a lot of online resources. COVID changed our way of thinking. We've had to adapt to how we train and get the message out to the folks, especially in the professional development series. So take a look at things like TED Talks, online courses sponsored by AFTO, NACCHO, the USDA and FDA have a lot. Your local state and universities and your extension agents are a great resource for some additional training that you can add to your to-learn list. Another thing is learn one thing new every day. I mean, I try to do that. I am, unlike Jennifer, I am as old as dirt. And I am not the most computer literate guy in the world, but over the course of the last 7 years in my role, I've been forced into confronting the uncomfortable and learning how to use a computer and Word documents and PDFs and things of that nature. And I'm a big fan of ChatGPT, I'll tell you that, because it helps the old guy write just a little bit better. But take a look at those things that you might want to learn. Learn one thing daily. Use your drive time. This is what I do when I have to come into the office. I am a big audiobook and podcast guy. I'll listen to food safety podcasts on my way to work, or if I'm traveling on a plane. It's a great way to occupy your mind, learn a new skill set, or get a new perspective on something. while you're traveling or doing something that is normally not, I mean, let's all agree traffic's not a pleasant experience, but if you can make it productive and enjoyable and drown out the noise with some knowledgeable information, it's a good trade-off. Some other things that you can share, soft skills, sign up for, they've now been renamed. I keep forgetting, I haven't adjusted to them. The power skills. This is a lost art, and this is things that they don't teach in school anymore. And there are a lot of professional organizations out there that have done a really fine job facilitating a power skills training. And when I'm talking about power skills, I'm talking about problem solving, communication, both through emails and verbal communication, adaptability, critical thinking, time management, and probably the most important in our business is building and developing interpersonal relationships. Our relationships, especially with industry, are by nature adversarial, when in all actuality, they're symbiotic. The better we do, the better they do, and vice versa. Add a new skill in your personal life. I've been attempting to learn to play the guitar for the last 2 years, and I will admit it's going horribly, and much to the chagrin of my wife. But I still pick it up once a week and try to learn a new chord or whatnot. Learn a new language, try a new recipe. That's something I do every week. Just some helpful tips. And I'm going to turn it back over to Summer now.
Oh my gosh, they took her voice again. I don't know what's going on. I'm telling you guys, we need to help. We need to help Summer with it.
I keep getting stuck in the swamp. Can you guys hear me?
Yes.
Sounds beautiful. Yes.
Okay. I don't know what's going on. So let's talk about taking care of your body. This is the perfect time frame right now. It's January. Everyone's like, new year, new me. Let's kick it back to getting healthy. We ate too many cookies during the holidays. So let's talk a little bit more about that. Eating right, like I said, everyone's trying to kick it back into eating healthy in January. What about exercising? I like to kind of take that extra moment, maybe on my lunch break, try to take a walk around the neighborhood if I'm working from home or if I'm at the office, try to go outside and clear my mind, take a walk and get some exercise, get those 10,000 steps in a day. Reading, it's good for that mental health. And I saw someone in the chat earlier talk about having that library card and getting those, not only just going to the library to check out books, but you can also use your library card to get some online resources. That's a cool tip. Being around positive people, that really clears your mind and gets you on the positive track of things and looking at the bright side. Like I said, I am the unicorn, as Chris would call me. So this is kind of my little gig here. What about meditating or yoga? Kind of clear that mind, and again, with getting your mental health back in motion. What about do you guys have any other suggestions for taking care of your body? You can throw them in the chat.
I see Libby is a great resource, and I'm going to have to look that up because I don't even know what Libby is. So thank you for whoever posted that.
It is. I do know about Libby. It's an app you can use your online library card for, and you can get audiobooks, and it's really cool.
Oh, neat.
Everyone should check out Libby.
I'm gonna tell you guys, so I did one thing this past year. My husband had a stroke, and so we changed our eating, and we use an app called Bobby Approved. And I will tell you that food has made a huge, just even tweaking our food intake. And I saw that, from a lot of people in there, huge difference for us. Golf, all kinds of fun.
Adam, you're speaking my language. That is my absolute favorite thing in the world to do, play golf. I'm not sure it calms me down, but it's still a heck of a lot better than work.
Yeah, those are fantastic. And I'm going to piggyback off from what Summer just mentioned as well. So this is our 5th piece of gear that's going to help us to combat, you know, all of those obstacles that are going to get thrown at us as we're going through our mindset quest to personal success. And this is having goals, right? Now, I put on here, and I really encourage you to, in your guide, go ahead and write down SMART goals or type it up, you know, if you're doing electronically here. But SMART goals are just being more intentional about your goals, because, you know, like me, I set a lot of goals, and if I don't really hold myself accountable, I can kind of wiggle out of my goals, right? And so SMART goals just means that we love and care for ourselves enough that we're going to make our goals very specific. We're going to make it measurable. We're going to make it attainable and reasonable, which I think is so important. And we're also going to be time oriented with it. And give me a shout out in the chat too if you used SMART goals before. If you've heard of SMART goals, just give me a yes or thumbs up or something like that, because oh, good. Yeah, I was gonna say, I don't think this is probably anything like earth-shattering, right, to all of us that, yeah, I should write SMART goals, but do we do it? Now, I will tell you that those of you that have been on here multiple times every year, I do talk about that Jennifer should exercise more. I know this, right? And I used to set myself goals where it was very not attainable. I was like, okay, I'm going to go exercise like 3-4 times a week, and I'm going to do it in the morning. I am not a morning person. So right there, strike one, right? Jennifer's not a morning person. No, thank you. And then 3 or 4 times, okay, doesn't happen. It's a little too much. I will tell you that I finally got myself into a great routine, and it took me a while, right? Because again, we, you know, that swamp will pull us in, you know, we have the perils along the way that knock us off track. But I thought, okay, I'm not a morning person, and I need an accountability buddy. And so I needed to make it attainable and reasonable. So now I go to yoga. It's on Sundays, 9:30 in the morning to 10:30. I pick up my friend. So it's time oriented. I'm very specific when I go. I punch a card when I go, so I can see my measurement and my progress. And I made it very attainable and reasonable. And I'm trying to set myself up for success. And I will tell you, I'm pretty happy with the way that it's going. I finally, you know, hit the nail on the head, I would say, with my SMART goals. I would like to share a little study with you, because I think this is really fascinating when it comes to goal setting. So this is the book. It's called Clockwork, and I have it right here. It's by Michael Lewitz. I don't know if I'm saying his name correctly, but it's a great book. And there was a study done by the Max Planck Institute for Biological Cybernetics in Germany. It sounds quite fancy, doesn't it? But anyway, the study that they did is that they determined that people trying to find their way through a forest or a desert devoid of landmarks and without the sun or a beacon, so think of nothing to look at to guide us, they tended to walk in circles. And they walked in circles as tight as 66 feet while thinking that they were actually walking straight. So in this study, they took 2 groups of people. They dropped one group into the middle of a German forest. Don't worry, they put GPS on them. And then they also dropped another group in the Sahara Desert. And they were like, okay, we're going to give you a couple hours. We want you to walk straight. And you'd think, okay, well, that should be pretty easy, right? I should be able to walk in a straight line. That's the goal, right? Walk in a straight line. So when the moon or the sun was not visible, this is what they found out, that then the people, when it was visible, let me do that one first. When the sun and the moon were visible to these folks, either in the desert or in the forest, they were very straight, right? Because they had something to focus on. They had, you know, they could look at the sun, they could look at the moon, and they could follow it. But when it was cloudy or there was no moonlight or, you know, no sunlight and that, people reverted to their looping patterns immediately. And then when the terrain started getting rough, like remember on Summer's slide there, we talked about all of those obstacles that get in the way. That's a lot of rough terrain, right? So when obstacles started getting in these people's way, they also started naturally kind of looping back around. And so they ended up, you know, back to where they started. So it was very interesting because they said, you know what, people can't walk straight without a landmark. And when complications present themselves, they often send people in a whole new direction yet again. But yet they think they're going straight. So why should we care about this study, right? When talking about goals? Well, it's just that if we don't set ourselves up with SMART goals that are specific and measurable, attainable, reasonable, and time-oriented, and hold ourselves accountable so there's not a lot of wiggle room, what will naturally happen is that we might start off great, right? Like we might have this goal here, but then if an obstacle comes at us, like life, remember all those things that you were putting into the chat when Summer was talking. I mean, it was just going like a house of fire, wasn't it? It was just whoo, like really fast, you know, like a mudslide or whatever it was, right? All these things, right? Because there's always going to be obstacles in life. There just are, right? That are going to try to knock us off. And if we haven't set ourselves up with goals and set ourselves up with things to help us when we encounter those obstacles or when it gets cloudy, right? We're going to just circle back around and go back to where it's very comfortable for us. So very interesting, setting ourselves up with SMART goals and making sure that we don't loop back around. And how many times have we done that when we've set ourselves up for a goal, like in January? We're in January, right? 2025. We probably, a lot of you have set a lot of goals. Or, are we going to be able to achieve them? Where will we be at the end of the year? And I will tell you that some years, I end up looping back around. And I'm like, Jennifer, God darn it, like you're back to where you started from. You didn't set up smart enough goals, Jennifer. You didn't account for things that could get in your way. So goal setting is super important. Another thing to pack into our gear to help us combat this, so the whole entire swamp of toxic attitudes is called like a morning 15 minutes. And a morning 15 minutes is just setting aside, and again, we call it 15, it's whatever you'd like to make it, but you take some intentional time in the morning to set yourself up for a positive mindset to be able to tackle the day. Because don't we all know that we love our day to be this beautiful straight line, but reality is that we're going to get things thrown at us that are unexpected, just like in that study. The terrain, the obstacles, whatever it is, that angry person calling, my children, not cooperating and wanting to do, somebody gets sick, something happens. And so this morning 15 minutes is just simply setting aside some time and doing the things in the morning that will help you set yourself up for a positive mindset for the day. So in chat, throw a few things in there. What are some things that either you do or you've heard of people doing or that we could suggest, to everyone to be able to do to set ourselves up for success in the morning during that 15 minutes? Exercise, absolutely. Pray, stretch. Coffee. I always see coffee every year. Yeah, make my bed. I'm trying to get my son to understand there's huge studies on that, right? That making your bed leads to greater success. Devotions, yoga, coffee, meditation. Yep. Must get done. Play with my dog. Oh, yes, these are so good. Go outside. Yep. Uninterrupted time to think. I love that time too. A to-do list, the sunrise. Absolutely. I listen to a podcast in the morning now. Yep. Even though it's difficult, getting up on time in the morning, maybe not. Yes, absolutely. Reflecting, news radio. Oh, nice. Feed my chickens. That's so nice. Daydream, music. Yes. Isn't it interesting that what I don't see there is I don't see people saying, grab your phone and get on social media, right? We're not saying that, are we? We're like, do all those things that set yourself up for this, for a positive start to the day. So we can, set at least, set ourselves up for success, right? And getting to bed early. Absolutely, absolutely. Those are so good. Y'all are amazing. So that is our number 6 one. Let's look at what our number 7 piece of gear is. And that's summer.
So how easy is it for us just to stay in our own little comfort zone? I know I am completely guilty for staying comfortable and just moving on along in our own comfort zone. Change is hard for a lot of us, and I will say I am right there with that. But sometimes you just have to embrace the change and leave your comfort zone, and that's the number 7 item for packing in your gear. If you embrace that change and leave your comfort zone, that's going to help your attitude combat that toxic attitude, and you will have success falling in your lap. Get out there, embrace the change, leave that comfort zone. You know, think about in the past, maybe changing jobs, and that's something big for me. You know, staying in your comfort zone. You know, I don't want to maybe apply for that big promotion or a different job in a different agency because I'm just comfortable where I am. And then maybe you did do that in the past, and I am like that. I made a job change and I haven't looked back. It was so hard for me to leave that comfort zone, but now I'm glad I did. And there's all kinds of things that you can look back at and say, wow, yeah, I really did have to leave my comfort zone. And then you see those different results follow once you do that. Feel free to throw some examples in the chat box about maybe how you left your comfort zone and embrace that change. But that is a big one, number 7, moving on. And I think Chris is going to go on to number 8.
All right, so the next tool that we're going to put in our bag is a fail-forward attitude. To keep yourself on the path of lifelong learning, try adopting a fail-forward attitude. Henry Ford famously said, "Failure is the opportunity to begin again, only more intelligently." Think of failure as a step on the ladder of success. Lifelong learners know that failure is part of success, which is why they accept their failures and learn from them and improve their strengths. They know that the more failure they will embrace, the stronger and more resilient they'll become. Many of you, I'm sure, are familiar with the phrase "failure is not an option." It is attributed to Gene Kranz, who was an American aerospace engineer at NASA and a recipient of the Presidential Medal of Freedom. This line was made famous in the movie, which you see behind me in my screensaver, Apollo 13, starring Tom Hanks, Bill Paxton, and Kevin Bacon, among others. Failure is not an option, although in this instant it was appropriate. Without failure, we can't learn, we can't grow, we can't move forward. How many times do you think the NASA engineers failed before they successfully found a way to run a 60 amp lunar landing module on a 12 amp generator and scrub the CO2 out of that lunar landing? It didn't happen on the first try. They failed and failed and failed again. And each of those failures was a step on the ladder to them correcting that issue, overcoming the obstacles, and saving that flight crew's lives. So I will go on to our next one, which is growth mindset versus a fixed mindset. Growth mindset versus fixed mindset simply states, combats the entire set of obstacles and swamp of toxic attitudes we talked about. This is a big one to make sure you pack for your quest. It starts with self-image and self-talk. You are your only limit. It's important to understand that. Ask yourself, what's the worst that could happen? If the worst thing happens, how can I respond? We can't always control what happens or what happens to us. The only thing we can control is how we react to that. I saw several mentions of golf. It's my favorite thing to do in the world. So I'll put a golf analogy out there. Has anyone ever been on the course? You had a difficult approach to the green. Let's say you're 195 yards out over water to an elevated green. The pin's tucked way in the back left of the green, almost an impossible shot. What's the worst that can happen? You may skull it. You may hit it fat, hit the water, fly the green. You're still playing golf on a beautiful day, on a beautiful course, hopefully with a cold beverage or two, and you took the shot. It's important to remember you took the shot. If you miss, drop another one and fire away. Take the shot. Take multiple shots. Heck, I don't care if you 10 cup it. Go, Roy, go, right? If you've seen the movie, you know he ran down to his last golf ball trying to clear that pond in front of the 18th green at the US Open. So take the shot. Don't be afraid. So now that we've covered all of our tools in our Mindset Quest backpack, we're going to move on to some differences between fixed and growth mindset. So let's first define what a fixed mindset is. A fixed mindset means you believe intelligence, talent, and other qualities are innate and unchangeable. A growth mindset means that you thrive on challenge and don't see failure as a way to describe yourself, but as a springboard for growth and developing your abilities. Most fixed mindsets come from a place of fear, an unpleasant emotion caused by belief that someone or something is dangerous, likely to cause pain or a threat, a feeling of anxiety concerning the outcome of something or the safety and well-being of someone, a mixed feeling of dread and reverence. So what I'd like you guys to do is look back at your page 1 in your participant guide, and we're going to go over some things, and I want you to decide if they are if you mostly agree or disagree. And what we're trying to determine here is who has a fixed mindset and who has a growth mindset. So as you can see there, go ahead and fill it out on your participant guide. And if you want to post some in the chat, and we'll give you a few seconds, and then we'll go over some of these together. And if you've got anything that's not on here as an example, feel free to throw it in the chat. All right, Michael, I've been there and done that before. All right, everybody had a chance to kind of go through that real quick. All right, so we're going to cover them. We're going to cover them together. Your intelligence is something very basic about you that you can't change very much. Would you consider that a fixed mindset or a growth mindset? Very good. You guys are nailing it from the start. All right, let's move on to the next one. You can learn a new thing, but you can't really change how intelligent you are. Would you say that that's a fixed mindset or a growth mindset?
Totally got it.
You guys are all over this. No matter how much intelligence you have, you can always change it quite a bit. Fixed or growth?
Nice.
You guys are pretty much perfect right now. Great job. You can always substantially change how intelligent you are. Fixed or growth? Very good. You guys are all over this. You are a certain kind of person, and there's not much you can do or can really be done to change that. Would that be a fixed mindset or a growth mindset?
They're awesome.
And this is one of the statements that drags me into the swamp of the toxic swamp of attitudes from time to time. But you're right. No matter what kind of person you are, you can always change substantially. Would that be growth or fixed? Growth. You guys have got this in the bag. You can do things differently, but the important parts of who you are can't really be changed. Would that be a fixed mindset or a growth mindset? Again, all over it like that hobo on that hot pocket. Great job, guys. You can always change basic things about the kind of person you are. Would that be a growth mindset or a fixed mindset? Well, I don't know how y'all did in school when you were in school.
Gosh.
Yeah, I don't know how y'all did when you were in school or not, but you aced this exam. So well done. Very, very prepared. And I'm going to shide it back over or throw it back over to Tour Guide Summer.
Good job, everyone. That was great. All right, so we are going to work on exercising our mindset. So if you guys want to turn to page 9 in your participant guide. So in your participant guide, and it's also on the screen if you don't have double monitors, you're going to see some fixed mindset statements. And what we're going to do is work through these and change them to be growth mindset statements. And Jennifer has this awesome prop here. She's going to roll the dice.
Since you know we're in a quest, right?
That's right. You got to make it fun.
Yeah. All right. I'm just going to roll once for the first one. How's that, Summer? And then
okay. Yeah. Perfect. So let us know what number we're going to work on.
Okay. All right. Here we go. Okay, everybody. So here we go. I'm going to do
number 3. All right. So number 3 is I'll never be that smart. That is a very fixed mindset statement. So let's work through the chat. Give us some answers. Let us know how you can rework that into a growth mindset statement. I'll never be that smart.
Oh, they're all over it.
Yeah, I can learn that. I look forward to learning. I can always learn new things.
Nice. Oh, they got that one so great.
That's awesome. Good job, guys.
Should I do another one really quick? Because they really got that one really well.
Yeah.
Okay, okay. I'll do it once. Okay, again, let's see.
Number one. All right, I am too old to ... Is this, man, I thought I heard Jennifer say that earlier.
You need to do that, right? But I am too old, yeah.
I'll never be too old. That's good. Lifelong learner. Look at that. Age is just a number.
Yeah, yeah.
Good job.
Nice.
All right, you want to roll it again?
I'm gonna really, I'll do it twice. So let's add. Okay, everybody, we're gonna put some adding
Okay.
into it. So here's one. So I've got 5
Okay.
plus.
5 plus 5. Yay, 10. All right. I'd never get that job, so I'm not going to apply.
Ooh.
What's the worst that could happen if I apply? All right, apply anyway. Be realistic.
I was gonna say, Chris can speak for that. Mindy, you're right. Yeah, because he said that. Yes. Mm-hmm.
Someone put, I applied for
Learn
the
from-
job and got the job. I'm amazing. I like that.
Interviews are great experience. That's a good
There's
one.
a lot of comments in the chat box about that, about using the experience. If you don't get it, you've got a skill set to help the next time it comes available.
We have a saying, in our family too, that if you don't ask, the answer will always be no. And so I feel like that applies to this, right? If I don't try, I mean, it's always going to be no. I'll never know, right? if I got it or not. Yes, don't say no for them. I like that, Taylor. Oh, these are good. Nice. Do you have time for one more? Time is
Yeah, let's do another
one
one.
more. All right, let's do one more. We'll do single roll. Let's see what I come up with here.
Okay.
Oh, we already did we do 5?
5.
No, we
No,
did, okay, no, we
we
didn't
were
do
at
5. We
5.
did 2 5s last time. Okay.
Yeah. It's
5 must
too
be our number.
hard.
It's too hard.
Love the challenge. Nothing is too hard.
Ooh, ask for help too. Remember when that was in our swamp of toxic attitudes, Chris, when you were talking about that too, asking for help. Mm-hmm. No, challenge accept. Nice.
I like that.
Oh, challenge me. And I love it when y'all like write it in capital letters too, because you can tell that it's that passion behind it too. I always say that, if you put it out into the universe and you're like, oh, I'm gonna do this, right? Like that helps because you're just throwing it out there. You've got that passion behind it too. Oh, these are so good. I love it. They're fantastic.
You all have any fixed mindset statements that you want to throw in the chat box and we can work through them as a growth mindset statement?
They're so funny. I'm just reading through it. I'm like, life is too boring if everything is too easy. That's good. And hold my beer. That's funny. Oh my goodness. Famous last words. Our friend actually, yes, had a shirt made because those were his famous last words after breaking his arm.
Oh, I don't have time. That's a good one.
Oh, that's a good one. Okay.
Yeah, so how
throw that
do we
one up
flip
there.
that
So
one to
we
a
don't have
growth
time.
Mm-hmm.
So how would you flip that to growth? I don't have time. I don't have time.
What can I delegate to free up my time?
Mm-hmm. I could make time for that. Yeah.
That's good.
Yeah, if something's important enough, I can make time. Mm-hmm.
Yeah.
It's true. If it's important, I can make time. Mm-hmm.
That's a good one.
Plan my day. That's great. Yes. Nice. Oh, that's fantastic. Those are good. Those are really good. Nice. Well done, everyone. Those are fantastic. Well, so there's extra ones on there. And so if you could work through those later, because I know we don't have time to go through them all today. But if you look at the bottom of page 9, and I'm going to stop sharing on my screen here just for a moment, but on the bottom of page 9, you'll see that we also put some psychological tools to master for success. There's 9 things listed here. They are so good, I have to tell you. And again, some of these things are things that all of you have mentioned before, but some that stand out to me is like comparison is the thief of joy, right? Huge thing, huge. Small challenges, break them into small parts. How do you eat an elephant, right? One bite at a time. Okay, so that's what we suggest is, one bite at a time. Yeah, I love that, Chris. Yeah, how do you nail it? One bite at a time, Chris. You got it in there. Be persistent. Don't wait until you feel like it. We call it Eat the Frog. There's actually a book called Eat That Frog. And so we've always used that terminology around our house. Like, I'm like, okay, I just need to eat the frog, get it done really quick. I love the celebration one because, again, how many times are we so hard on ourselves? We're like, oh, I thought I'd be further, or oh, I want to achieve this. I want to achieve that by now. I should be to this point. But how often do we ever stop and look back and be like, oh my gosh, look at how far I've come. I've made it so far. I'm going to celebrate my successes and being grateful. On some of these things down here, I was thinking, wow, you could incorporate these into those 15-minute time in the morning. You could even set up some time at the end of the day where we start off with our gratefuls, or we end with our gratefuls, or meditate. So there's so many good things. If you look on page 10 as well, there's also some growth mindset questions here. And these are here for you to do with what you will, but they're here to support you in that growth mindset. Because like we said, today you're going on your quest with us as your guides, Chris and Summer and I, and each other, helping each other along the way today by putting all your stuff, all the answers in here and helping everyone out. But you're going to start your quest afterwards. You're going to be off, and we're here to support you. And here's something to help support you. If you look at like the upper left of those growth mindset questions, it says like, what made you think hard today? Wonderful end of the day kind of question to reflect back on. Did anything make me think hard today? Or am I kind of just taking it easy, right? Am I in that continuous learning kind of mindset? And the one next to it that says, how will you challenge yourself today? Great one for in the morning, right? How am I going to challenge myself today? What am I going to push myself towards? So those are some nice tools to help you on your mindset quest. Now, go ahead and let's turn back to page 4, because you also need a little moolah, right, for a quest. It's pretty helpful, kind of like that idol behind Chris that's made of gold, right? We need a little something for our quest. To be able to maybe buy snacks or pay off a troll to go under a bridge and stuff like that. So on page 4, and I think, Amy, if you could throw that up there on the screen, you'll see that the 9 boxes there, under each one, it says packed and ready to go, and it says not quite yet on those 9 boxes. So go ahead and mark off which ones you have packed and ready to go, which I saw that some of you did have some packed and ready to go. And if it's not quite yet, go ahead and mark that off too. But then there's the 3 columns. You can add up your columns, and the ones that are packed and ready to go ahead and fill in your coins at the bottom. And there you go. You've got some coins to take with you when you go on the rest of your quest after you leave us today, to get yourself started with it, to see what you've got ready to go. I would like you to look at this page and pick out one thing that you have not quite ready to go. And on page 11 of your guide, you'll see that we've given you a space here where I'd like you to just pick one thing that you want to work on and set yourself up with a SMART goal. Just one. So pick one of those things. Don't overwhelm yourselves, and set yourself up for success. And having done that, then we want to thank you so much. It's been our pleasure being your guides today on our quest for personal success. And we want to leave you with this question. Perseverance and passion for what we do is the secret to achieving personal success. It's by far the most important factor, even more than talent and intelligence. So you've got this. We're behind you 100%. Have a great 2025. Loved your engagement. Y'all nail it this year. So go forth and conquer on your personal quest. Thank you. And thanks.
Wow. That was quite motivating. You guys, you're three of my favorite people in the world. So thank you so much for bringing your happiness and excitement and ways to celebrate to us. I want to thank all three of them, Jennifer, Summer, and Chris, for participating and presenting today, along with all the other presenters that have been with us. You guys did a great job. So thank you all very much. And I would like to throw it back over to Autumn.
Thank you. Thank you, everyone. Thank you, Brenda, for leading us through today. It was very, very exciting. And I learned something every single time I hear these people speak. So you are going to want to know a couple of things. One, we've covered all the objectives. We've been following along. I know for sure we've covered all of them in the greatest way possible. So that's what we did today. If you want to switch to the next slide, I can go forward because you're probably going to want to know a few things. One, an evaluation. If it hasn't already been dropped in the chat, I'm going to have Daphne drop that link because we do want to hear your thoughts about the content for today. Because we are going to have boot camp next year. I mean, fingers crossed, right? And so we want to know if there's anything we need to change. Everyone from yesterday's session asked about a few things. One, is there going to be a recording? Yes, there is a recording of this. It'll be posted by the end of the month on the event page. Do we get CEUs? Yes, you do. If you need CEUs for NEHA or AFTO, everyone will be getting a certificate of attendance. And you will have a CEU page if you need that as well. Let's see, what else was there? Recording CEUs, I think that was it. So that'll all be posted on the event page. We're going to take all the question and answers and the PowerPoint slides, and we're going to post it all on the event page. It is AFTO/bootcamp. So go to our website for that. You can email me. It says to email me for your certificates, but don't do that, please. So just wait, be patient. Your certificate of attendance will be coming in probably a week, week and a half. I think that I've covered everything I need to, but I do want to take 1 second to thank the work groups. If you want to switch to the next slide, these people are the brains behind this. We brainstorm every year to make sure that we're continuing to provide the right content and things go well and how to add some more fun. So thank you all to these individuals that make the magic happen. And so with that, everything is finished. And we'll go to the next slide and you'll see that Daphne has dropped the evaluation into the chat. If you can do that now, because I know you're all busy, if you can do it now, really, really appreciate it. Thanks for attending. Amy, you can play some music too.